Good morning. Morning. Right, let's make a start. Good morning, everyone. My name is Alex, and I am a Class 21 Fellow. Later on today, you're going to hear a lot more from me. But to start us off with, I wanted to do something that is really common practice in Australia and Aotearoa, New Zealand, the two countries where I'm from. And that is a land acknowledgement. And that's because in Australia and Aotearoa, New Zealand, we rarely start anything without it. For us, a way of acknowledging the traditional custodians of the land is both a peacebuilding and a reconciliation action. So this happens in Rotary clubs, at universities, and before we start any meeting. So in the spirit of sharing an Australian and New Zealand cultural practice, today I want to acknowledge that here at UNC, we are standing on the land of the Ino, Tutelo, Saponi, Okinichi, and Shakori Native peoples. We pay respect to their elders, past and present. And we treat this land with the love and the care and the respect that the Okinichi people do so today. Thank you very much.
Thank you, Alex. Well, good morning. We're delighted to have so many people back with us in person here at our wonderful 21st annual Duke-UNC Rotary Peace Center Spring Conference. Let me clear this slide. Oh, I'm not ready for that yet. So my name is Randy Lickey, and I'm the host area coordinator here for the Duke-UNC Peace Center. And together we gather here around the theme from self to society, envisioning our relationship to peace. Each year, the graduating class gets to choose its theme, and this is the theme that Class 21 has chosen for their conference. As a courtesy to all the presenters and all your fellow attendees, if you have not done so already, please pull out your telephone or other device and put it on mute or turn it off. I used to say that if it went off in the middle of a Rotary function, that was an automatic $100 to the foundation. Having said that, at a meeting I was chairing, my phone went off 2 minutes later, and I peeled out $100. We are very fortunate to have with us today past Rotary International Director and past Rotary Foundation Trustee Bren Stiles. Bren is also a past chair of the Rotary Peace Centers Committee, and at this time I invite Bren to come up and share a few words.
Thank you very much, Randy. It really is a pleasure to be here this morning and see so many familiar faces, and even better to see some new faces. So thank you. I bring you greetings on behalf of Trustee Chair Barry Rassin, who unfortunately couldn't make it this weekend, and all of the trustees of our Rotary Foundation. As you know, the Peace Centers program is a gold standard program within Rotary, and all of you are to be congratulated. I've been very fortunate. As Randy mentioned, I'm a past chair of the Rotary Peace Centers, and I've been involved with the fellows at many different levels. When you sit on the Peace Centers Committee, and as chair, as Peter Kyle was past chair of the committee as well, you work with the centers on the selection of the students who are going to be going to whichever center they've been selected to go to. After I was finished my role on the Peace Centers Committee, I became a reader, reading all of the applications I was assigned, which is really an exciting thing to do when you see out of 800 applications the quality of people that we're getting applying, and then the ones that are selected. And then when I was on the committee itself, I had the opportunity to work with the centers and the center directors in the selection of the students. But today is really special because that's almost coming full circle, and I'm seeing the result of that now with this graduating class. And the class, as you come to the end of this chapter, as you graduate, I congratulate you. But what we as Rotarians are most excited about is to see what your next chapter is going to be. As you no longer just Rotary Peace Fellows, you're Rotary Peace Fellows alumni. So congratulations and best of luck. Thank you very much.
Thank you, Bren. We appreciate your taking the time to come south to warmer weather to be with us today. I would now like to, now I am ready for this slide. I'd like to introduce our Duke-UNC Rotary Peace Center's board. And I asked them to stand and be recognized. Susan Carroll, our managing director. Susan. John Abels from Duke University. He's up in the back. Sharon Thomas from UNC. Carol Allen, our longtime Rotary representative. Tom Lassiter, our program coordinator, he's up in the back. Our faculty directors, Catherine Adcock-Admay from Duke. Suzanne Menin from UNC. I believe we have at least one, if not both, of our co-directors emeritus, Francis Letham from Duke. Is Francis here? Jim Peacock from UNC. All right. And we have two alumni representatives. They live just around the corner, so they, I don't know why they're not here, but Muyatwa Satali, who lives in Geneva, and Karina Ito, who is in Brazil. So if you have a chance at any time during the day to meet and speak with any of these folks, please do, and thank them for their service and inspiration and support of our program. In addition to our Peace Centers board, we have several current and past Rotary officers here with us today. It's obvious our Peace Center would not exist but for the commitment over many, many decades now of past and present Rotary leadership in creating and sustaining this program. Today we have with us past Rotary International Vice President and past Rotary Foundation Vice Chair, Dean Rohrs. Dean is here. We have past Rotary International Director Ken Morgan. Past Rotary International Director Peter Kyle. And we have 5 sitting governors, at least registered. I hope they're all here, but our own home district here of 7710, District Governor Veronica Bent. District 7545, Governor Justin McCarthy. No. District 7600, Governor Rudy Garcia. District 7610, Governor Renee Laws. And District 7680, Governor Deborah Corbett. I would also like to recognize our Rotary Peace Center's program director who's here with us, Laura Descher. So as always, the greatest fear of someone standing at the microphone calling out names is that you forget or miss someone. If I have, please forgive me. It's all my fault. So thank all of our leadership, past and present, for being with us today. Throughout the term of each of our fellows' fellowship experience here, they are matched with a local Rotarian that serves as their Rotary host counselor. This is really an invaluable resource for our fellows, and it distinguishes our fellowship from any other fellowship that I know. Our host counselors are there to greet the fellows upon their arrival, help them get situated, help them acclimate to our Southern culture, and learn the ways of our area. And we have with us today, I know, a number of current and past host counselors. I couldn't call out all the names, but if you have served or are serving, I would ask you stand and be recognized. Thank you. It is, as always in Rotary, I believe we get more back often than we give. And if anyone is ever interested in serving as a host counselor, let me know. So today you have the privilege of hearing from our second year class. They will soon be graduating and moving on to their next phase of life. During their presentations, you may hear a variety of viewpoints. In fact, you will hear a variety of viewpoints, some of which you may or may not agree with, which is okay. But please remember, everyone's entitled to their individual views, and that courteous discourse is a key element to what we do here. So please listen attentively. If you agree, that's wonderful. If you disagree, that's fine too. But we always do it respectfully. So now I would like to ask our managing director, Susan Carroll, to come up. She will introduce our first year class and give some other important information.
Thank you, Randy. Good morning, everyone. Welcome to our 21st annual Duke-UNC Rotary Peace Conference. It actually seems a little bit like yesterday I was introducing the 20th anniversary year. My name is Susan Carroll, and I am the managing director of the center. And I want to welcome all of you here in the Nelson Mandela Auditorium at the University of North Carolina, as well as our virtual audience who is tuning in from all over the world. So in a few minutes, you'll have a chance to meet our graduating Rotary Peace Fellows who will present the work that they have undertaken during their time as graduate students at Duke and UNC. After short presentations, they'll participate in a series of discussions where you'll have the chance to join the conversation by asking questions. I'm going to now introduce to you our first year fellows, and I'm going to read out your names and ask you to stand up, please. Leila Abed, Patrick Asenero, Haruna Fukaya, Alexander Zaborovska, and studying at UNC, we have Jacinta Bailey, Gideon Capolasa, and Paula Saldivias Mendez. So everyone's bios is in the conference program. Like we did last year, we have asked several alumni to send us short videos that will tell us about the impact of the Rotary Peace Fellowship on their personal and professional lives. If you were here last year, you might remember those. You'll see 3 of these videos today. One of them will start right after I'm finished speaking now. And I think you will agree that they're amazing testaments to this program. But before we begin, I want to go through a few important points for our in-person audience. If you need to exit the auditorium, please do not walk along that back row because we are filming and you could end up on YouTube. There are restrooms upstairs and downstairs. As Randy said, please turn off your mobile phones and electronic devices, and also make sure you're not also tuned into one of the live streams as well while you're sitting in here, because we'll hear all of it twice in garbled form. So, and for all attendees near and far, we will alternate questions between our live and virtual audiences. So virtual audience, please ask questions. We are monitoring the Q&A in the webinar. And please limit questions to an actual question. No comments, statements, or lectures, please. And with limited time, ask one question. Please do not ask a 3-part question. There's coffee breaks and there are there's a lunch break. So you have time to chat with the fellows and ask them additional questions then. And with over 300 people attending the conference today in person and over the webinar, our fellows will not be able to answer every question. So for that, we apologize in advance. So I'm going to go ahead and introduce the sessions that are coming up, and then we will have one of the alumni videos before we actually begin. So the first presentation will be by Nguyen, who will tell you about the social insurance program in Vietnam and its implications for peace. And after we'll have a panel on bridging the gap, community health, and building more peaceful societies with Alexis, Mwanza Kabongo, and Estefania Rodriguez. So without further ado, let's begin.
Morning. My name is Nguyen, and I'm currently studying a Master in International Development Policy at Duke University. Growing up in a poor household in southern Vietnam, I experienced the harsh realities of corruption and poverty firsthand. Watching my people in the community, including my parents, work multiple jobs, yet struggle to provide for the families, for my passion to create positive changes and thrive and make tangible difference for the community. This led me to seek opportunities to uplift the community and foster local economic growth. In 2014, While pursuing my undergraduate studies in Japan, I founded my own NGO with the goal of empowering the community, youth, and promoting peace. During the peak of the COVID-19 pandemic in late 2020 in Vietnam, there was a transformative moment occur for me while I was volunteering at the Social Insurance Central Office in Ho Chi Minh City, Vietnam. I was shocked to see long queues of people waiting at dawn. These lines were not for Black Friday event, but for the people waiting to withdraw their pensions early from the social insurance system. I cannot help but wonder, why are people willing to trade their future retirement security for cash in hand today? And to me, at that moment, it became evident to me that that policy changes are essential to help these people, and only through effective policy can we truly make a difference in people's life. This experience serves as the driving force behind my journey with the Rotary Peace Fellowship and my studies at Duke University. Thanks to the opportunities that given to me by you all, I had the opportunity to engage with experts in economic and social policy within a dynamic academic environment. I have also learned about the peace framework, which has helped me to analyze conflicts, identify root causes, and design effective interventions for peace development. And also for my master project, I'm working with Professor Eddie Maliski to work on this problem of early pension withdrawals in Vietnam. So what exactly is social insurance and who is that for? To help you have a better understanding of the Vietnam social insurance system, let's compare it with the US pension plan. So in the US, there are two main systems, Social Security, a public plan, and IRA, individual retirement account, or 401k, a private retirement plan offered through US employers. While people really cannot access their Social Security funds before retirement, you have the option to withdraw the money early from your IRA or your 401k, but with some penalties. While in Vietnam, there is only one pension system called social insurance, which is designed as an economic safety net. It is meant to provide the citizens with financial protection and support during certain risks in life, such as sickness, unemployment, retirement. And contributions to the social insurance system are mandatory for both employers and employees, and the funds are managed by the government. In Vietnam, people who are unemployed for at least 1 year can have the option to withdraw a one-time lump sum payment from the social insurance system, which allows them to receive the full benefits as a single payment before retirement. However, this comes as a trade-off. Withdrawing these funds forfeits their pension tied to the retirement plan, unlike in the US, where people can access the fund from private retirement accounts such as IRA or 401k in emergencies. Vietnam allows people to withdraw the money from the government funds and without any penalties. So they can just withdraw the money freely. So like Social Security, which originated during the Great Depression, of Vietnam's social insurance system highlights the importance of providing assistance during economic hardships. It is the mechanism for us to take care of each other, that we are financially protected. If there are excessive withdrawals and the system fails to support the people, it could lead to severe economic hardships and social instability. When people get old without pensions, they will just become poor, homeless, and if this number is large, it could lead to unrest and violence across the country. In fact, in 2015, thousands of Vietnamese workers went on strike for 6 days to protest against a new social insurance policy, which only allowed them to withdraw the money upon retirement. They wanted the flexibility to access to this fund while unemployment, to cover daily expenses while seeking for new jobs. So it's extremely important to ensure that the social insurance system functions effectively to prevent such outcomes and promote peace and stability in society. So the rising trend of one-time social insurance withdrawal in Vietnam in recent years is alarming. While from 2016 to 2019, new participants exceeded withdrawals. The trend intensified from 2020 during the pandemic, with nearly 900,000 withdrawals in 2021 alone. The demographic breakdown reveals that many of the people who claim for this lump sum payment fall within the age brackets of 20 to 40 years old. The largest age group to withdraw this money is concentrated from 30 to 40 years old, with over 40%. Notably, a higher portion of women, 55%, withdrew the money compared to men, 45% in 2021. So why did the people withdraw the money? A survey conducted last year reveals that 60% of them lost their job and they had no other saving to sustain their life. The problem seems obvious and simple. People lose their job and they need the money immediately, but it's actually deeper than that. Many people don't understand the system, the benefits of the system well, and they view it as the personal saving account so that they can just withdraw the money freely anytime they want. Also, low-income households and women at workplace, they lack support for childcare, making it really hard for them to work without withdrawing the money early. And physically demanding jobs in manufacturing sectors lead to early retirement desires and job loss challenges in their 40s. So currently, to ensure that people have pension when they get old, the Vietnamese government is proposing two options. First option is to reduce the total amount of money that they can withdraw to only 50%. And the second one is that new participants from 2025 onwards, they cannot withdraw this money anymore. And alongside with the government proposals, I will also try to take action with my NGO. I will launch an educational campaigns to raise the awareness of long-term consequences of early pension withdrawals and the importance of having financial security for retirement. I will also establish support programs to assist low-income households and women at workplace. This could involve offering financial literacy workshops and vocational training to empower them to have another source of income to overcome their own financial hardships without the need to withdraw the money early. And also, I will try to collaborate with employers and trade unions to improve the workers' employability through tailored training programs, focusing on skill development and capacity building. As I wrap up my presentation, by promoting financial stability, ensuring social welfare for the citizens, and fostering an equitable society, we can lay a strong foundation for lasting peace, not only in Vietnam, but also all over the world. Together, we can build a society in the future when people get pension when they get old, and we contribute that to peace and prosperity for generations to come. Thank you.
Wonderful. So I hope you enjoyed that presentation. I know I certainly did. It's wonderful to be here with all of you today in my role as director of DCID. I'm very proud of the small role that we play in helping train these wonderful fellows. And I'm especially proud because as my master's thesis advisor, I've been able to see this project from the onset. To paraphrase John F. Kennedy, Mai did not choose this problem because it was easy. She chose it because it was hard. It is one of the hardest policy problems in Vietnam today. And, it has required a lot from her to learn how Vietnam finances the pension system, to collect original data on this, to do her own survey, to see how Vietnamese people were experiencing this. And solving this problem has critical implications for Vietnam. As you can tell, it has implications today for economic stability and political stability in Vietnam. And it has big long-term implications for Vietnam as the Vietnam's population is aging. People are going to rely upon these pensions. And if they're drawn out too early at this rate right now, it means that there won't be a safety net for those people down the road. And so trying to figure this out has been critical. I have a question for Mai, but I did want to just add a few things of context that I thought were really interesting as so, I think it may help as you're all thinking about the questions you want to ask. So one is that, Mai pointed to it that this situation became exacerbated during COVID in Vietnam, and that's absolutely true. But the thing that I think makes this problem salient is that it didn't quell after COVID. It continued to exacerbate with more and more people still taking it out. So it's a problem that currently exists. Second, Mai pointed to that there's a large number of what we would consider relatively young people, 20 to 40, 30 to 40, that are still working age, that are leaving their jobs to be able to take out this money, and that it's felt disproportionately on women workers. And I wanted to add context to that too. Vietnam has been, over the past 30 years, the second fastest growing economy in the world next to China. Poverty alleviation in Vietnam has been dramatic over this period. But and most people would have said that the group that Mai is highlighting today were the winners in the Vietnamese economy. These were the people that had moved. They were usually internal migrants that moved into the manufacturing sector, that were receiving higher wages, that were part of the fastest growing part of Vietnam. So it's really fascinating to see that this is the group that's struggling. This is the group that is feeling most challenged and is taking these drastic steps. And the third thing I wanted to highlight, and this is going to lead to my question that I'm going to ask, is that you can tell that the Vietnamese government is taking this very seriously. The National Assembly will be debating this policy in May. And they have put forward this, a policy solution, a reduction in the lump sum, or actually not taking out the lump sum at all. But this has only made the problem worse. As Vietnamese people have learned that the National Assembly is taking these policy options, more people felt obligated to go and take it out. So the problem is sort of spiked as the solution has come. So Mai's ability to answer this question is really pressing. Okay, so here's my question, Mai. So, you aimed your NGO and what you want to do is work on these activities to provide training, to provide capacity training, to provide understanding, with the idea that if people had a better understanding of the system, better capacity to be able to, think about the potential solutions, that this might resolve it. But I wonder if there's kind of a tougher nut to crack here, that this is ultimately about trust in the government, trust in the integrity of the government to use these resources, or trust in capacity, whether they believe the government has the ability to be able to manage their money better than they can manage the money themselves. And so my question for you is, so how much, giving you the surveys that you've done of Vietnamese people, how much does trust play a role? And is it trust about integrity, or is it trust about capacity that's the biggest challenge?
Thank you, Eddie, for such a really impressive statement in the beginning. Thank you for the question. So before we can dive into the topic, I just want to say a little bit about the history of the social insurance. So before the 90s, social insurance, so the only state employees were able to get the pensions, and it was not for everyone. And starting from the 90s, the government, they wanted to do a revolution to make pension like it's accessible to everyone, not just state employees, also private employees, state employees. And that was in that moment, one time social insurance policy was not even born. No one knew about it, and there is no such thing in the International Labor Organization standard. But then there was loopholes, because the private employees, when they started, because there was a campaign and there was a revolution of it, and it started in the 90s. And when private employees, they started contributing to the system, there was no records of how many years, how long they have contributed, and like there was no record. And then when they lost their job, they requested that money to be back, like to get that money back, because they said, I contributed this money, so I had the right to take it back. And then the authority at that time was thinking about this, this like a short-term solution for them, for those who lost the jobs, and just give them the money back. And it was the premise for this policy. And then it has become a norm, like a social norm in Vietnam, that once you lose the job, you can just have the option of withdrawing this money, for your immediate needs. So it's actually a really complicated. It was started from really like many years ago, and the Vietnamese policymakers, they actually wish that they did that in the past, because it created so much consequences right now, and it's really hard to stop this. And so talking about trust, I did an online survey to the Vietnamese people, and I have some data. So I can tell you that 33% of them don't trust the government, because there is no transparency. There is no official data of how to invest the money. And I'm Vietnamese, and I contributed to the system like several years when I was working in Vietnam. But I think I didn't really have any idea of how to invest the money, and can I really get the pensions when I retire? So, and according to my survey, it's 34% don't trust the government, because they cannot find any data about how the money is invested. So this is a really big problem. And also, and 43% thought that it's their right to withdraw the money. So, so it's just because of the loophole in the past that they didn't really trust the way the government managed their money, and creates really such a big problem right now.
Yeah, that's a great answer. So would you say that, putting these things together, that it needs to be more than just constraining people from taking out the money, and more than just educating people about how the system works, but actually real government transparency about how the money is being managed, how it's being used, and that needs to be communicated alongside the policy.
Yes. So I think there should be more conversations between the government and the people, because the people, they don't understand well. From my survey as well, 30% of them don't understand the benefits of the system, and you think it's as a personal saving account, they think about short-term needs instead of long-term security for their retirement.
That's a great answer. Okay, so why don't we take some questions from the audience? Oh, wow, okay, so right up here, 12 o'clock, yeah. Yeah, in the blue tie, yeah.
Good morning. My name is Rick Maddox. I'm from the Petersburg Breakfast Rotary Club out of District 7600. Thank you. My question is, I noticed there you only focus on one retirement program, and that's from the government. And many countries have offered alternatives in addition to companion programs. We have the IRAs, we have corporate pensions and such. Is there a plan in your program or a suggestion to maybe offer those companion programs with restrictions as well to complement this versus just relying on one? Because if it fails, it's catastrophe, but the others can make up, whether it be corporate plans or whether it be a government plan like our IRAs and others.
Thank you for the question. So right now, in terms of the government side, there is only one pension system, and actually this social insurance system, they covers everything. If you have sickness, if you go to the hospital, they will pay for a portion of it. And if the woman they're pregnant and they can also get the full salary from the social insurance system. So it just covers everything, but in the pension system is included. And right now, so in the US, we have like 401k or IRA, but in Vietnam, we don't have private. We really don't have similar things. And if you want to think about the pension when you get old, get some money when you get old, probably you need to know how to invest by yourself, like with stocks and bonds or real estate. Like it's not a part of the government plan. Yeah, I think that's the challenge in Vietnam right now, and I think we should learn from big and developed countries like in the US. But it's just right now it's just one one system.
I see a question right here in the red jacket. Oh, let's go to the virtual. Okay, yeah.
Okay, this is from virtual. It's audience. Does gender inequality in educational and economic opportunities play a role in the higher number of women withdrawing the insurance? Would that be a systemic problem?
Can you say it again?
Gender inequality, is it is inequality in gender capacity, is it a systemic problem that's contributing to?
Yeah, I think I mentioned in my presentation that women, they have a higher proportion there was a higher proportion from women, which is 55% to withdraw the money, compared to men for 5%. So, and also talking about wages, there is a disparity between the income for women and men, because the biggest beneficiaries of the social insurance system are from the workers from the manufacturing sectors, and they usually have really low wages. So if they lose their job, or if women, they don't have enough money to take care of their kids and for raising the kids, it's really easy to just withdraw this money because it's only shows that they can have the immediate money for their needs right now. So yeah, I think there is also a gender disparities that contribute to these problems.
Okay, so I'm getting the signal that that we have to stop. We don't want to like compound, but I can tell from the audience there's a lot of people who want to ask you more questions, so you'll be busy during the coffee break.
Okay.
Yeah.
Good morning, everyone. My name is Estefania Rodriguez. I am about to graduate from the Master of International Development Policy at Duke University, and I'm sponsored by District 4185. And well, thank you so much for being here. And a little bit, I want to say something before I start with the topic, that this is related to my master's project, and this is also related to a big project at Duke University called Latin 19. So I'm going to talk about Latinos Called Journey, which is a community-informed policy project in North Carolina. So this is the way that my presentation is going to be structured. I'm going to start talking a little bit about my health journey, then how I ended up working in health policy in the US, thanks to this project, how I've been involved in Latino population, work in North Carolina, and how this has turned into community-informed policy. So my journey started in Mexico in nutrition and health policy. And this started back when I was in college, when my father was diagnosed with diabetes, which is the #1 non-communicable disease. And I started seeing that other family members and acquaintances and family friends were also getting similar diagnoses. And I started wondering, like, okay, this is a disease, it is serious, but there are like some other issues that are not only medical issues. And I don't have a medical background, but it was something that caught my interest because I became aware there was another area called social determinants of health. And so right after college, I started working at the health department in Mexico. And that's where I started seeing like a lot of the data and like the reasons why a lot of people in Mexico were having a bad quality of life and or were suffering or living with some non-communicable disease, such as diabetes or obesity or other things that are also related to bad nutrition. So first of all, like I wanna put here like this quote that is in the Rotary International website. And this is why also I think health is important, like overall, but also like for Rotary, because good healthcare is everyone's right, yet 400 million people in the world can't afford or don't have access to basic healthcare. And so in the United States in 2022, 26 million of Americans didn't have health insurance, which is 8% of the population, which means that there is a development issue in a highly developed country. And so I also like started thinking about how could I contribute to something here. And well, mostly like, and based on my interest in the past is because social determinants of health are non-medical factors that influence health outcomes. And also given that health equity is one of the core aspects of these big projects. So health equity is basically ensuring that all individuals have the same opportunities to be healthy, regardless of their background or circumstances. So this is a glimpse of how health disparities are in North Carolina, and this is mostly related to the Latino population. So there are over 1 million Latinos in North Carolina currently, and 1 in 3 Latino individuals don't have any type of insurance. And this has led to health disparities that persist due to many barriers that we're going to see in the rest of the presentation. So the rate of uninsured people in North Carolina from Latino ethnicity is 31%, which is the highest among the rest of the ethnic groups. And so for this project, it is very important the participation and involvement of community health workers, because they are the ones that help bridge the gaps and provide support and help anyone access the healthcare system in the US, not only for Latinos, but for everyone. So where did the Latino population came from? Or so mainly from Mexico. 38% of Latinos in North Carolina claim Mexican heritage, and 18% of them claim Central American heritage. And the countries in Central America are Guatemala, El Salvador, and Honduras. And so this is an opportunity for people from these countries or that have families from these countries or travelers to these countries can get the benefit of enrolling in Medicaid, especially after the expansion that took place last year. And this is part of like a national thing, which is the Affordable Care Act. And so this is targeted at low-income individuals, and a lot of the Latino population are part of that low-income demographic. So it is an opportunity for Latino people to join the system. And so Medicaid is a federally and state-funded program made of low-income individuals. And as I mentioned, I think to the expansion, there is more opportunity for people to join. And they also have to be eligible, which means adults from 19 to 64 years old that have an income up to 138% of the federal poverty level and that whole legal status in the state. And so to address this, I worked with some strategies to increase Medicaid enrollment among Latinos in North Carolina. And this is based on two aims. The first one was to explore the perceptions and knowledge of healthcare among the community health workers. And for this, I analyzed the information that came from 3 focus groups with community-based organizations that work in Latino issues in the state, and also with community health workers to better understand what are like the main barriers and constraints why people are not enrolling in the system. And the second aim was to understand how the healthcare system in the countries of origin may inform strategies to promote Medicaid enrollment among Latinos in North Carolina. And so for this, I created a tool to compare the systems of the countries that I mentioned before and how these systems are similar or different to Medicaid. And so people maybe that in one point of their lives access to those health systems or like their family access, they can be able to understand what is Medicare about and how can they access and why is it important to have health insurance. So it is crucial to enroll Latinos in Medicaid because they have been historically marginalized. And some of the benefits of helping people enroll through healthcare workers, community health workers, is to access affordable healthcare, to then be able to reduce health disparities among all the ethnic groups, because this is like a social benefit for everyone, to gain financial protection, especially in care of an emergency, to improve their economic integration in the state, and to enhance health outcomes, and like finally and overall for community well-being. And so after analyzing the focus group results, I came up with some key themes and insights, which are based on what the community-based organization leaders and the community health workers were saying. So awareness and understanding of health insurance came up first, and it means that people, Latinos, have limited knowledge and misconceptions and fears. It means that some of them don't know what is healthcare, what is health insurance, why do they need it, and why is it useful, and also some misconceptions and fear are based on things that they have heard or read about accessing a social benefit, and that is something that might affect their legal status or something like that, which in a lot of cases is not true. And there are other barriers to enrollment, which is like that most of the information is in English, and sometimes it is in Spanish, but it's not like adequately translated. And even if they know the word, they don't know what they mean. And there are also some priorities for improvement, which are some educational initiatives that could be implemented through community health workers. And they also suggested some methods of delivery, which is like related to having digestible materials in both English and Spanish, and using digital platforms like to inform like everyone, not just like people that maybe have a critical condition and they need to access the healthcare system. And so then to understand how to implement these community recommendations, with the tool that I mentioned before that compared the healthcare system, and with the review of the tool by experts and at the same time are representatives of the countries like Mexico, Guatemala, El Salvador, and Honduras. I was able to review the tool. They gave like their insights and approval. And in that way, the tool was reviewed like to complete this step and have the most accurate information. So when we deliver this to the community, it means that it's gonna be like official and validated. And so finally, the community-informed policy recommendations were to strengthen community health workers programs to improve healthcare access, to disseminate the toolkits in the consulates and the health department of North Carolina. This like mostly because many people still have family members that are still nationals from the countries that I mentioned, or that hold dual citizenship, and in some way they still have some connection and or visit the consulates, and that's a way to bring their attention into enrolling Medicaid. And also it is important to assist Latinos in North Carolina to access healthcare, and this will be done with the help of community health workers. And so all of this is related to my journey and future career. And over the last couple of years that I've been here, I've been able to gain new perspectives on health. I've been able to work with amazing people at both Duke and UNC, and to be involved in this project is such a blessing for me because it allowed me to better understand what community engagement means and how community can better inform policies, and to be able to co-create policies by and for the community, which is something new for me. I mean, I know a lot of people have worked with that, but in the past when I worked in policy in Mexico, it was more focused on just giving recommendations, thinking of what will be better for people living with nutrition and health issues. So this is very meaningful for me, like being able to work with the people that are gonna be benefited by these types of policies. And this has also been very helpful to increase and to, keep building my service and leadership skills that are the core reason of why I joined this fellowship. So what I hope, overall, is to go back to my country and implement what I've learned here, and how to better engage with the community and how to help them to access the healthcare system. And also, I will be so grateful if I get the opportunity to work with community health workers back home. And so finally, I would like to thank Latin19 and Duke University for providing the data for this project, and well, most importantly, Rotary, because without Rotary's help, I wouldn't be able to be here and have work with such an amazing team. So thank you so much for your attention.
Hello, everyone, and thank you for your time. Today, I'm going to talk about my work and the opportunity I have to achieve my dream. Thank you to Rotary. My name is Alexis Mwanza Kabongo. I am from the Democratic Republic of Congo. I am a Rotary Peace Fellow. I'm also a student in the Global Health Concentration at Gilling School of Global Public Health. And I'm going to talk to you about the Asiphephe project. In the healthcare field, community health workers are trained and they contribute a lot in different healthcare interventions. Their involvement greatly contributes to accessing primary healthcare in their communities. This expertise can be used in peace activities, such as addressing gender-based violence. I will talk about my dream. I will talk about the community focus. I will talk about the involvement in gender-based violence, and then I will conclude. Before joining the Rotary Peace Fellowship program and the Gilling School of Global Public Health, as a medical doctor, I recruited and I trained community health focus in different healthcare interventions. For example, preventing and treating malaria. And I witnessed the impact of this training in the community. When I applied for the Rotary Peace Fellowship program, my dream was to use my experience with the community health workers to train them for peace activities. So I've been asking myself a question on how can we train and deploy community health workers for peace within their communities. This question led me to the next question, which is, as a medical doctor, how can I bridge peace and health? As we know, it's hard to talk about peace without health and to talk about health without peace. Community health workers are members and leaders of the community. So they share the same dialects, the same socioeconomic status, the same lifestyle, and more. In the healthcare sector, they are trained for different health interventions. For example, vaccination for children and pregnant women. They trained in educating the population for different interventions, such as antenatal care, and they're also trained on HIV and tuberculosis care and more. So what are some community health focused success stories? Community health focus contributed in increasing the immunization coverage for children and pregnant women by educating the community. For example, in the Democratic Republic of Congo, the number of unvaccinated children decreased from 18 million to 14 million between 2021 and 2022. The percentage of women who reached 4 antenatal care visits during their pregnancies went up from 41 to 48%. Community health workers also play a role in reducing morbidity and mortality due to malaria by educating the community to use bed nets, by treating kids in the community care site, and by teaching the community to keep their environment clean. For example, in the Democratic Republic of Congo, the prevalence of death due to malaria decreased from 15% to 10% between 1990 and 2019. So how can we capitalize on these success stories? How can we bridge peace and health using these success stories? My idea for bridging peace and health is to apply community health workers to the area of gender-based violence. As we know, gender-based violence is a peace and health concern in South Africa and many other countries around the world. I'm going to talk a little bit about gender-based violence to highlight this concern and to show the role played by the community health workers. So what can I say about gender-based violence? Gender-based violence is any kind of violence against a person because of their gender. Gender-based violence is mostly associated with unequal power imbalance. And gender-based violence is also, gender-based violence also includes child sexual abuse and harmful traditional practices such as early forced marriage and female genital mutilation. Today, gender-based violence is a health and peace issue. According to the World Health Organization, 1 in 3 women has been victim of gender-based violence during their life. And the consequences of gender-based violence go beyond health. Children and women are the most affected physically and psychologically. Gender-based violence creates chaos in community. Most families are broken and children are abandoned. Most cases of gender-based violence are unrecognized because they are not reported. almost 50% of women have no other choice than to stay silent because they are unable to support their kids alone due to the power dynamic within the household. During my applied field experience, I traveled to Johannesburg in South Africa, and I had a chance to interview community health workers and other healthcare workers who were involved in the Asiphephe project. Asiphephe is a Zulu word that means let us be safe. This project is between health and peace because, as I said, gender-based violence is between health and peace. And just by the name of the project, Asiphephe, let be free, you can feel that there is a need to create peace within these communities. Asiphephe is a 2-year pilot project in 2 clinics, GP and Malvern, both clinics in Johannesburg. And as we know, more and more gender-based violence is becoming a pandemic. And it's a very sensitive topic. Not everyone is able to talk about it if not trained. What is special with this project is to bring peace. Community health workers are trained with the necessary skills and knowledge that allow them to take care of the victims of violence. So those community health workers are becoming a safety net of all the victims because they are the first receivers of all those victims. Then they can refer them to relevant stakeholders such as social workers. In South Africa, community health workers are part of the healthcare system. So they have their regular duties in the clinic. For the Asiphephe project, a total of 80 women were enrolled in the project, and a total of 26 people were trained, among them community health workers and other healthcare workers. For this project, trained people receive gender-based violence cases. They find a quiet place to talk to them, to understand what is the problem, and then to refer them for further assistance. This project is going through different challenges. For example, there is a breakdown in communication between community health workers and other healthcare workers within the clinics. And in those 2 clinics, gender-based violence cases are not a priority compared to other health issues. Malvern and GP clinic and the surrounding areas are mostly unsafe. And lastly, the gender-based violence referral system is not working properly. For example, the social worker is present in the clinic only once a week, which is not enough. So what do community health workers think about addressing gender-based violence in these 2 communities? As we know, men are the perpetrators and youth are the future perpetrators of violence. So community health workers believe that involving men and youth in the solution would be a good start to win this fight against gender-based violence. So what are the next steps? I met a couple of times and discussed this topic with the Rotary Club of Johannesburg. With this club and an NGO called Lady of Peace, we talked about bringing the training beyond gender-based violence. So the Rotary Club of Johannesburg and the Lady of Peace are ready to meet with the community focus from these 2 clinics in order to support them with extra training in gender-based violence, but more with added peace-related training that can help to decrease violence in their community. Moreover, the idea is to use the community focus from these 2 communities, like the Rotary Voice, in their community promoting peace. In conclusion, I would say community health workers significantly contribute to health and peace. And gender-based violence is an example. It's just one example that can be extended to other peace, to other aspects of peace. There is a need to invest in training and upskilling of community health workers. Working in a multidisciplinary team will bring significant and sustainable changes in community. So my conclusion is health and peace can be bridged together. Toasa Kijila, Ngiyabonga, merci and thank you.
Great. Thank you so much for those presentations. My name is Suzanne Maman, and I'm the UNC Faculty Director for this fellowship program. And I'll just say a few words on behalf of my colleagues at UNC. We are so invested in this program, not just because of the opportunity we have to train these fabulous fellows to see their work beyond our training programs, but because of what they bring to our other students at UNC. You can see from their presentations, their backgrounds enrich the conversations in our classroom in so many important ways. So it's really a privilege to be part of this fellowship program. So through this panel on community health as a building block towards more peaceful societies, we heard from two fellows who use their background and training in clinical medicine and public health to explore the critical role of health in peace building. And there are so many ways that peace building can be fostered through improving access to healthcare. Improving health outcomes can address some of the underlying causes of conflict, such as poverty and inequality. Healthcare programs can empower communities by providing them with knowledge and resources to take control of their own health outcomes. Investing in healthcare infrastructure and systems can help strengthen institutions at the national and local levels. Addressing health challenges can mitigate the risk of further instability. And finally, health populations are better able to participate in and contribute to the economic growth of their societies. So Estefania examined the role of health insurance in providing the Latino community in the US access to health care, while Alexis was involved in a pilot study that engaged community health workers as agents of peace to support HIV-infected women who are experiencing intimate partner violence in South Africa. At the root of both of their presentations is the belief that health and healthcare workers are central to the support and security of populations affected by conflict and instability. So I'm going to ask a couple of questions for our panelists, and then we'll open it up to our residential and online audience. And I'm going to start with a question for Estefania. Given the focus on Medicaid expansion in North Carolina as a means to reduce health disparities, what are the key obstacles to Medicaid enrollment among Latinos that you've identified? And the second part is, what policy recommendations would you make to streamline the process and make it more accessible to this population?
Thank you for your question, Suzanne. So the main obstacle that we have found are that people don't even know that there is this like expansion happening and that they are able to access Medicaid. Sometimes they don't even know what is healthcare, what is a healthcare system. So it's lack of awareness, lack of understanding, and a lot of literacy issues. And so, yeah, those are the main barriers. And yeah, for these, like the policy recommendations will be to do more materials that are, you know, like bring materials through social media that are easily digestible and culturally competent, and this way the community, Latino community, can understand and be aware of accessing the system.
Thank you. Now for Alexis. We know that in the overcrowded and understaffed clinics like the ones you worked in Johannesburg, community health workers are already very busy. They have many responsibilities in the clinic. So yet your project demonstrated the critical role they can play in addressing an important determinant of women's health, which is gender-based violence. How can we really expect health workers, community health workers, to add this to their workload, especially without additional compensation?
Thank you for your question. I had the opportunity to discuss this topic with all the community health workers. And one of the recommendations they asked was to train more of them. Only some were trained, which is not enough. And about the payment, something we should know is South Africa has a different system. I mean, in South Africa, community health workers are paid. It's not enough, but they get something. But in other systems, like in Congo, community health workers are not paid. So at the beginning, community health workers, those are fantastic people. So they accept to work for no payment. They accept, they like, we can do it, it's for our community. So they're grateful for the little money they're getting, but to go back to your question, as long as we can train more of them, they will find a way to manage, to do their work in the clinic, and to take care of victim of gender-based violence and more.
I'll turn it back to you, Estefania. Another question. Given the focus on Medicaid expansion in North Carolina as a means to reduce health disparities, what are the key obstacles to enrollment among Latinos that you've identified?
Yeah, so the main obstacles are that sometimes people actually show up to the office, like the government office, to enroll, and they face a lot of discrimination. So that is like the first approach for them, like with like a government institution in some cases. So they come and they bring documents and stuff, and the community health workers like already have told the potential enrollees that are at the office that you need to bring this and that, but like their job is already done. Like they cannot like come with them to like an appointment and like do the whole process. So they face discrimination. Sometimes we've heard from the Latino community that they get asked questions that had nothing to do with Medicaid, like I don't know, like, what are you doing here? You need this extra document that is not on the list, and they have to like come back and forth. And then there's another question, you missed this, you missed that, or like, why is there so many people living in your household and stuff like that? And so the community listens to this and they like feel rejected and they don't want to come back, or like they don't know what to do about it. So they go back to the community health worker, and like there is no actually good strategies to like manage that. So sometimes the community health workers do that extra effort of like, you know, coming with the person that wants to enroll and like do the process together with them, but that like that is not possible like in terms of capacity. So it's that they approach the system and they feel that rejection and they don't come back.
And so the second piece of that is at the policy level. What can we do to overcome some of those barriers that they're facing?
Yeah, I think at the policy level, I think we are able, or the people that are trying to enroll can be able to track if they have like some bad type of treatment and like report that, or like keep track of what are their rights and what aren't, and just maybe have like, you know, some sort of digestible information of like what is good to ask, what is not good to ask, like what document do you really need, and how to like, you know, be aware of your rights and mention that when you are at the Medicaid enrollment office. And I think that could also be part of the community health workers' duty of like communicate with them and tell them, okay, there is this manual and it is like easy to read, and like if you have more questions, like we can figure out something later, but like to be able to explain them like they have a right to access the system. So I think, I mean, it is policy, but also like part of relationship building and community engagement.
One more question for Alexis before we open it up. How do you ensure the safety and confidentiality of women seeking support from community health workers in situations of intimate partner violence, especially in contexts where reporting or seeking health might pose additional risk to the women?
That's a big challenge for safety and privacy. What I've seen in those two clinics is, let me take one clear example. When I was talking with community health workers, one day we used the parking lot because there was no space in the clinic. So trained community health worker, what they do to keep confidentiality and privacy, they have to do their best, find a place. But still, it's a big challenge. As I said in my presentation, gender-based violence is not a priority in the clinics because clinics are first taking care of a health issue, like someone who comes for headache or stomachache. They will take that person first than the one who comes for gender-based violence. So finding a space is a real challenge. So the way community health workers are trained, they need, before starting to talk about that sensitive topic, they need to find a place which is really private. Even though it's a parking lot or it's sitting in a car somewhere around the clinic, but they need to find that space, talk about it. But it's a big challenge that has to be addressed by the South African government because it's the only one who can provide more space for privacy and confidentiality.
Thank you. Okay, we'll open it up for questions from the audience. And I see a couple right here in the front.
Can you raise your hand that I can see? Down there, then you can do it, Ola.
Thank you. Good morning. Both of your presentations were wonderful, and it's nice to see you again, Professor Maman. My question is, I think Alexis briefly touched upon this, but were there any challenges or hesitations in recruiting the community health workers? And were there any challenges that the community health workers face from the community, such as culture or stigma on the topic?
So one good thing with the community health workers, I said it at the beginning, community health workers first are members of the community. Those guys are trusted in the community. That makes their job a little bit easier. But when it comes to gender-based violence, it's something else. You know, for a woman to open up to someone else about gender-based violence, as you know, in Africa, it's almost a taboo for a woman to talk about what's going on in her household. But the way community health workers are trained, they know if they see that there are some signs of violence, they know how to approach women, how to talk to them. But it's not easy. It's not the first time. I mean, it's not at the first contact that the woman will talk. Maybe the community health worker has to come back 3, 4, or 6 times until the woman will feel like, okay, I can talk about it. But still, it's a big challenge to make people talk. And I said it, the more women are trusting those community health workers, the more they feel like they can have solution to the issue, the more they're talking. So how things work back there, if a woman went and talked, then once she's back in the community, she will tell her friend that I went there and I got a solution. There is someone who listened to me and gave me a solution. And that's how they like breaking all those barriers. But it's a big challenge.
Take a question from if there are any from the online audience.
This is for Alexis. you talk about education and changing perceptions, and but what about the law? And if the law is not upholding or penalizing people for gender-based violence, how would you address that, or what suggestions would you make to make the changes there?
So I wrote that in my master paper. I'm writing about gender-based violence. So the South African government is passing some law to protect women. And as you know, the thing with law, it takes too long for it to be like really in practice. But South African government is working on passing some law that can protect all abused women, also men, because some men are also abused, as you know.
We have time for one more question, and I see two, so sorry, go here, and hopefully you'll find time at lunch break for that.
What do you both feel or think about the role of corporate interests in promoting public policy?
I will let Estefania, because she's the policy person.
Yeah, so thank you for your question. So it is not like a topic like we deep dive in, but we know that there's like a lot of influence, and that like a lot of the things that community health workers know and say are because of some training that they have gotten from the private insurance system. But like at the same time as in the US, there's a mixed system. They also have to be part of it at some point. So sometimes there are like some plans that are like linked to Medicaid, but are also private. And so they have to know that to tell people what's the better plan for them. So there's like a big influence on that side. And there's like, I don't know how to say, like a best practice to that. They just have to look at the options and tell people what is more affordable for them in that moment, like given their job or whatever situation they are in.
I'm not a law person, but I think, as I said, South Africa is already working on that. But the thing is, I'm going to talk in an African perspective, which is different here. It's nice to have laws, but it's better to apply those laws. We have many laws, but we are not applying them.
I think I had a cue that we have time for one more short question. So I did see a hand raised here. Let's go back right here. Yeah.
Thank you. I wanted to ask Estefania, I know that your research has been focused on people who are documented, but we also know that there's a large population of undocumented people in North Carolina in particular. And we also know that Medicaid, even if everyone applied, wouldn't cover everyone. There are people who are going to not be eligible. Is any of your work being done on individuals who are undocumented, who also deserve health care?
Sorry, can you repeat the last part?
Is any of your work being focused on individuals in North Carolina who are not documented?
Oh yeah, so yeah, sadly we cannot do much about it, but there's like a pilot system where there are like clinics where people can go and get treatment. But I mean, in the case of Medicaid, I think the only way they can access is if they have like some very, very critical condition, or they're like an emergency, like when it happened during COVID, but there is just like no way at the moment to like break that barrier. And even if we look at the census data and all of that, we are not able to gather information about people who live undocumented. So that's a big issue.
All right. Well, I wanted to thank our panelists, and we will close this session. Thank you so much for participating.
So we are going to break for coffee right now. And if I could ask everyone to aim to be back in the auditorium no later than 11:05. Enjoy your break.
They're done.
I know, I, you know what you did after?
Yeah.
Once you finished, you rolled your eyes.
Oh my God.
You were great.
Thank you.
I'm sorry. I'm so sad.
I don't know if you remember me from.
I do.
Yes, good to see you. Good to see you.
I think it's the same place that everyone there said, oh, they're adopting.
Absolutely.
I'll return this by 11. Yeah.
Can I ask everyone to please take your seats? Huh? Please take your seats. Thank you for taking your seat. Maybe if I start. Please take your seats. We're going to get started. Huh? Please take your seats. No. Thank you. Welcome back. We are going to start this session with another alumni video, and I apologize to the virtual audience who can't actually hear the videos, but they will be available on our YouTube channel later. And then the panel that will come immediately afterwards is we'll look at the search for sustainable development and peace, looking at 3 different country cases. And again, just a reminder that our fellows' bios are in the program. So we're going to go ahead and get started.
Good morning and welcome everyone. For those who are online with us, thank you all for being here today. My name is Christian Menin and I'm from Brazil, but today we're going to talk about Colombia. Well, Colombia is a beautiful country, as you can see by this photo. And I had the opportunity to live there in 2021 and 2022. And I had always dreamed about living in Colombia, fun fact, because I really wanted to learn how to dance bachata and salsa. And after this period living in Colombia, one thing that I can say for sure is that dancing is definitely not one of my skills. So anyways, When I was living there, I was working and living in an active conflict zone, working with the United Nations to verify the living conditions and the situation of former guerrilla communities after they signed a peace agreement in 2016. So after this period, I was living there, and that complex context, I was trying to understand, and I applied to be a Rotary Peace Fellow, in fact, several times, right, Susan? Thank you. Because I really wanted to better understand that reality that I was experiencing. So after 2 years studying at Duke and UNC, focusing in conflict, peace, development, today I have a better understanding of why that peace agreement that was signed between the Colombian government and the former guerrilla is not working. Just a disclaimer, many pictures or photos that you're gonna see here today, they're mine. And I was instructed to tell when I'm portrayed in the pictures. Hopefully that will get me a job. So just a bit of a historical background for us to understand and to talk about it today. Colombia, a country in South America, has a population of 44 million people. And a specific moment in Colombia's history was between around 1930s and 1958. There was a period in Colombia called La Violencia, or the violence. It was a bloody period, a fight between the conservative political party and the liberal political party. They were fighting for power. And in 1958, they reached an agreement, a political agreement. However, this political agreement did not consider important portions of the population in Colombia, meaning rural peasants, students, communists, left-wing influencers, and more. So this portion of the population started making pressure on the government to attend their agenda, for example, land reforms. The government not listening to them and repressing this portion of the population, so this portion of the population, they decided to go to arms, and they formed guerrillas, and the most important one is the Revolutionary Armed Forces of Colombia. In Spanish, its acronym is FARC. So after this period, over the years, these guerrillas, they established themselves in rural areas of Colombia, in remote areas. And around the 1980s, paramilitary groups were created, backed by hard right-wing politicians and Colombian elites to fight against these guerrillas and to protect properties and landowners, right? Over time, unfortunately, these guerrillas, they left behind their ideologies and they resorted to drug trafficking to fund their activities. But that also happened with the paramilitary groups resorting and relying on drug trafficking to fund their activities. So with time in Colombia, well, assassinations, massacres, kidnappings, extortion, bombings, minefields, you name it, started to become the reality in the country because of the conflicts among the guerrillas and the paramilitary groups. So if you add on top of that the government armed forces, that the conflict was generalized and Colombia was immersed in a full civil war. In the pictures here, in the photos, you can see on the top right, the FARC army in 1999. The picture on the bottom right, there's a woman in the lines of FARC, and on the bottom right too, the lines and the army of the paramilitary groups. So just so you have a notion, after 50 years of war from 1964 to 2016, when the peace agreement was signed, these are the numbers, and they are terrifying. More than 7 million people displaced because of the conflicts. That represents 15% of the population. So more than 50,000 deaths, actually kidnappings, I'm sorry. And there are 450,000 deaths. And it's estimated that 80% of that is of civilians. So just for you to have a notion of the proportion of the war, it's estimated that only FARC had more than 20,000 soldiers. It was an army. Well, in 2016, Colombia, the government of Colombia, after many years of negotiations with FARC, and after many attempts of peace agreements with guerrillas, they reached an agreement in Panama. You can see the picture on the top left. They're represented by the former president of Colombia, Juan Manuel Santos, the FARC leaders, and also in the picture you can see Ban Ki-moon, the former Secretary General of Colombia, the former Secretary General of the United Nations, I'm sorry. So this was a big deal at the time, and it was considered a success. Juan Manuel Santos, the president, won a Nobel Peace Prize, and the country had hopes to finish this period. So this peace agreement brought important considerations about restorative and transitional justice, about transition of illicit crops, substitution of illicit crops, and many other aspects important to the conflict. But also it brought a step-by-step considering demobilization of former combatants, disarmament of former combatants, as you can see by the picture of the United Nations on the top right, and reintegration of former combatants. So this reintegration is the most important part of this peace agreement. And it brought the government committed to promote the reintegration, the social reintegration, the political reintegration, and the economic reintegration of these former combatants, all guaranteeing their security. So it was an important thing, as I said, and two important points are in this moment to highlight here so we can keep going. There were many guerrillas, active guerrillas in Colombia at the time, right? Not only FARC, but FARC was the largest one, the oldest one, and the one that the government struggled the most. That's why the peace agreement was only with FARC. Also, not all of the former FARC combatants agreed to sign this agreement. So as you remember, I mentioned it was estimated that they were like around 20,000 former combatants on FARC. Around 13,000 agreed to sign the agreement. The other part of it, either they went to other guerrilla groups or they created splinter groups. So after 8 years, we're in 2024, how do you think Colombia is now? Unfortunately, I don't have good news. From my firsthand experience in working and living in the state of Cauca in Colombia, the state is not present in the territories, right? And that's the most important problem here today. These communities, and here not only the former FARC communities, but also the rural population in Colombia, they lack access to basic services that the government should be providing. They don't have access to education. They don't have access, or restricted access, let's be fair, to education, to health, to jobs, to opportunities, to economic development. And here you can see the picture, this photo on the bottom left. We were visiting a community school, and the school was closed, and we were talking with the community leader. She was explaining to us that at the time they had received a donation of computers, and they were all locked in a room. They didn't have access to that. Unfortunately, that was the reality. This photo on the bottom right, you can see a basic health facility, and it was also closed. And the local villagers, they said that from time to time, someone would open it and assist the population, but they never knew when, how, who. So there is no presence of state institutions in those territories in Colombia, meaning the population has either restricted or no access to these basic services, no opportunities, there's no economic development, so they're left in limbo with no dignity. Okay, Chris. But then, well, you're talking about development, you're talking about the situation of the population in rural areas. What about security? So Chris, they signed a peace agreement, they handed over all their guns, so they're all safe, right? Unfortunately, no. So because of this long period of war, there are many grievances of this period. So all these former guerrillas, the dissident groups of guerrilla that came from FARC and dissident paramilitary groups, they're still very active in these zones. They're conflicting because of fighting for territory control over to profit out of illicit activities, right? And not only illicit crops, but illicit activities. So this provokes a lot of violence and still a lot of violence and killing of signatories of those peace agreements. And because of these conflicts that are still going on, this still provoking mass displacements of rural populations. So this photo on the top right, you can see I took it in a gym in a local community, and all these people, they got displaced. It was an emergency situation, coordination among NGOs and the local town hall and public authorities, because they were in a conflict. They had to flee their homes and leave everything behind, and they never knew that happened on a weekly basis. And they never knew when they came to this gymnasium when they would be able to go back, when the conflict would be over. So it could take days, it could take weeks. Unfortunately, that was the reality. The photo on the bottom right, you can see it's a town hall. And I had a meeting there. And the day before the meeting, a guerrilla exploded a car bomb and exploded the whole building. So that, unfortunately, is the reality of the violence in Colombia. And a side effect of that is that those peace agreement signatories that accepted to hand over their guns, and they were expecting or trusting the government, they have no economic and job opportunities, and they also have no protection. So they have to provide for their families, and they have to look for their protection. So what's happening now, some of those signatories, they are going back to the guerrillas. So they're going back to arms, and the conflict never ends. It's a cycle. So I ask you today, is there peace in Colombia? What did this peace agreement achieve? Was it worth it for this former FARC communities and combatants? Well, I don't have an answer to that, but certainly there's a lot of work to do on this. So, okay, Chris, you talked a lot. We understand after going all through this context, and it's a very complex context that doesn't have only one answer or one factor. What would be the alternative, possible alternatives? So one thing that the government is doing today, for example, the current government is trying to make peace agreements with other guerrilla groups, right? That would be reasonable. However, it doesn't address the root causes of the situation. I mean, if the government cannot commit and provide with the commitments that it did in 2016, how can it offer more and more promises to other groups and other portion of the population, right? So I believe that one factor that is actually already provided in the peace agreement is the locally development programs called territorially focused development programs. So is that the government, a policy that the government provide basic services to local communities in the rural areas, but also invest in these locally led development programs, providing economic opportunities, job opportunities, and infrastructure. You can see that this photo on the bottom right is one of the roads that I had to work and go to visit these little towns. That's the situation. So for example, these other two pictures are small-scale projects that former guerrilla communities, they were producing coffee and fish production. But how are they going to use and take this production to other places going through these roads, right? So it's not feasible, and there's no, it doesn't promote the local development. If the government doesn't have the capacity or this presence in the field, in the territory, it should be integrated with the private sector. Bring the private sector in, bring international community, make partnerships with local NGOs, international NGOs, but make it feasible, make it happen. So I believe that this peace agreement that was signed in Colombia, I understand it is a role model to other conflicts around the world. And more than anything, I believe in peace. However, the government must be invested on it and must be creative too. And I hope and I believe that those communities, especially these former combatant communities, can feel safe, as you can see in this picture. And one day, they can have the life that they once dreamed of when they signed a peace agreement. Thank you.
Hi, everyone. Assalamu alaikum. Thank you for joining us today, both those who are here and those who are attending virtually, including my family back home. I'm super excited to talk to you about a topic that I'm personally and professionally passionate about. From humanitarian aid to sustainable communities in northern Afghanistan. To understand the importance of shifting from aid to strategies for sustainable community solutions, we first need to consider the challenges of aid within Afghanistan. In the last 2 decades, Afghanistan has received a significant amount of aid. Yet due to lack of number of complex factors, Afghanistan remains with high level of poverty and vulnerability. Today, I'm going to share with you how I have personally observed this situation and my ideas for change. Well, I am Mustafa Rezaie, a Rotary Peace Fellow from Afghanistan. I come from a small, marginalized, and conflict-affected village in northern Afghanistan. Growing up, I went to a school that had been destroyed by war. I studied without access to basic school supplies. As a young man, I could only dream of going to the university in the US. And now I'm studying at the prestigious university like Duke. Do you see that photo is a proof? Thank you, thank you. And I would like to thank Rotary District 5495 who endorsed me as their first Afghan fellow. Thank you so much. Now at Duke University, I leverage my decade of field experience with rigorous study to address Afghanistan's challenges. As a Rotary Peace Fellow, I strive to create impactful solutions for my homeland's pressing issue among ongoing crises. Let us try to understand better the context in Afghanistan. Through my studies at Duke, indeed I realized the importance of historical, socioeconomic, and environmental context, in which this intervention takes place as a basis to identify the challenges as well as the opportunities and to come up with a potential viable policy. From historical perspective, as you can see in the slides, Afghanistan has a rich history that has been characterized by frequent political changes. It significantly impacts the country's stability and development over time. The 1960s marked Afghanistan's modernization era, during which substantial progress was achieved. Where women had equal rights, this made Afghanistan unique in the region. However, this era came to an end with invasion of Russia, and that led to civil war and emergence of Taliban in 1996. Despite these challenges, Afghanistan has demonstrated resilience throughout its history. In the past 2 decades, during the NATO intervention, Afghanistan has made a significant progress, but it has been disrupted by the Taliban, resulting in violence against minorities and restrictions on girls' education and women's work opportunities. Now let's see what are the socioeconomic problems while the country is under the control of the Taliban. Poverty remains one of the main challenges in Afghanistan. The poverty rate went up from 47% in 2019 to 70% in 2022. Around 2.5 million girls are denied education, and around 65% women forbidden to work. And 15.5 million people, which represent approximately half of the population, do not have access to adequate food. Humanitarian crisis, natural disaster have led to 6 million displacement in the country. This shows how the country is vulnerable. The climate change added additional challenges to political instability and socioeconomic problems. This significantly impacted the agriculture production, which is the main source of food and income for the rural areas, where 70% of population resides and 61% of them are employed in agriculture sector. Additionally, 60% of population relies on rain for irrigation, which is more vulnerable to climate change. Considering this problem, let's see how much aid Afghanistan has received for a humanitarian and economic recovery over the last 20 years. A total of 85 billion for a population of 38 million. This is in addition to billions of dollars for security and governance. You would think it should have been sufficient to build Afghanistan economy, right? Unfortunately, it was to be the case. What were the main problems? After gaining a better understanding of the context, I complemented my field insight derived from frontline listening to the communities by integrating literature reviews from diverse reliable sources, aligning with principle outlined in Paris Declaration on Aid Effectiveness. What are my findings? So I have found that challenges contributing to lack of long-term impact and sustainability in aid intervention in Afghanistan are absence of local ownership in aid policy, lack of alignment between donor strategy and national strategies, and lack of harmonization among donor short-term results where aid delivered lacked the durable outcomes, and lack of mutual accountability, which associated with poor understanding of local context and priority needs. For instance, a major donor for Afghanistan reconstruction was USAID, which often lacks the strategy and harmonization within the USAID itself. This is from US Special Inspector General for Afghanistan Reconstruction, SIGAR report. On the other hand, internal challenges such as weak government capabilities, corruptions, and inadequate monitoring and evaluation further exacerbate the problems. Now, given these challenges in context of Afghanistan, what can we do? Is Afghanistan having the financial capabilities to address these challenges? Answer is no, unfortunately. Afghanistan is aid dependent. How much aid is pledged by international donor and receiving Afghanistan while the country is under the control of Taliban? You might be surprised to hear that an amount of 6.9 billion in humanitarian aid, which is a huge amount if effectively implemented. Now, as a positive initiatives, I would like to share my personal experience engaging with community members to address priority needs as seen in the picture. In my role as a regional monitoring and evaluation manager, I collaborated with partners to design, deliver, and monitoring sustained rural development project in northern Afghanistan. After conducting a needs assessment, I combined humanitarian and development concepts to support women, children, youth, and farmers to enhance the long-term livelihood of communities in the region. Over 1.6 million people were impacted by this program. In the RTP program, we focus on good governance, education and employability, agriculture, and livestock management to address multiple needs of rural communities. It was in 4 provinces, which are highlighted in the maps. Despite the risk I personally visited the villages in Faryab, Jaujan, Balkh, and Samangan provinces, as you can see on the picture. It was risky, just a mile away from the Taliban. But I walked alone without weapon to show trust in the villagers and to better understand their needs. So you might ask, what made this program effective? Based on my observation, in comparison to many other projects, and based on third-party evaluation finding, the program was effective because the program addressed community needs effectively with no program overlap. Through the program, we enhanced effectiveness by addressing multiple needs of the communities. So what was the project impact? Well, evaluation findings have shown that SRDP has brought a significant positive impact on target beneficiaries and communities. How? I'll describe it very shortly, considering the time limit. Susan is timing now, maybe signal now. Please. In good governance, the project made a big impact because it improved by setting up local development platform and training community leaders. This led to better resource management and empower civil society organization. In education, significant changes were seen. With over 1,000 young women gain job skills through vocational training, such as tailoring, bakery, and many more skills. They also were provided with tools to start their business. Additionally, over 12,000 girls learned English language skills and computer and science at youth development centers, which were permanent centers built on those 4 provinces. In agriculture sector, 58 cooperatives and women farmers group were formed and trained. These initiatives enable them to process their agriculture products, adding value and facilitating market connections. As a result, jobs and income opportunities were generated for vulnerable groups and making the project truly impactful and beneficial. Given this widespread positive impact, we know that combination of humanitarian and development approaches work well for the communities. Therefore, this example can serve as a template for new initiatives seeking to address multiple needs that directly improve the quality of life rather than just delivering the aid. With this example in mind, I recommend the following to ensure more sustainable community solution in Afghanistan. 1, integrate humanitarian and development interventions for meeting multiple needs of vulnerable communities. 2, promote local ownership and participation in aid design and implementation. 3, enhance coordination among donors and align their strategies with national priorities for more coherent and impactful approach. 4, strengthening monitoring and evaluation mechanism to track progress, identify challenges, and improve project outcomes. 5, focus on long-term solutions that empower communities and build their capacity for self-reliance. Your support in ensuring these recommendations come to life is vital for advancing sustainable development in Afghanistan. My story is a proof of that. Together, we can make a meaningful difference. Thank you all for your attention.
Good morning. My name is Jorge, a Peace Fellow who, since the young age of 16, has been a soldier. I'm also from Chile, a beautiful and peaceful country where during my entire life, I have grown and thrived as a person, and as a professional. Because of my peaceful experiences in Chile, I had never had to think about being forced to migrate or experience displacement. So why I will talk about this to you today? Well, life in the military gave me the opportunity to do a lot of things in all sorts of places. I traveled to promote peace and stability in places such as the Balkans and the Middle East. I saw firsthand in how conflict affected people's lives and forced them to move from their homes, even had to abandon their dreams and hopes. But I also got to do a lot of important work back home. I had the opportunity to serve in Chile when natural disasters happened or support was needed in isolated regions of the country. These experiences, plus my current studies as a Rotary Peace Fellow, have drawn me into this particular subject. So, what are the causes of migration? What drives this phenomenon? Migration is something that every country in the world knows something about. Our continent, from the United States all the way down to Chile, is no stranger to this. It can be considered one of the biggest challenges that countries currently face. Climate change, conflict, and a search for a better living are among the reasons for people to migrate from one place to another. As an example, in Chile's case, the Venezuelan community grew from 8,000 people in 2012 to 500,000 people by 2020. And the Haitian community grew from 1,600 people in 2012 to 185,000 by 2020. However, countries have different approaches that show more of a reactive than proactive planning when faced with this dilemma. Chile's approach to decrease the influx of irregular migrants has been to use the armed forces as a containment security force deployed on the border. So my question is, are we willing to use this strategy, which could bring catastrophic consequences for the people who are mandated to enforce this, but also for the migrants who in most cases are looking for better opportunities? Over the next minutes, I'm going to argue for something that you probably didn't expect. I'll argue that the Army doesn't belong in the border in its current capacity. I want to show you how, by adapting the use of the military strength on the border, they can be seen as a force for peace building and humanizing rather than deterrence. The good news is that we already have existing examples that show us the way. So to give you some context, in 2010, the total migrant population in the country was estimated at 300,000. By 2022, the total migrant population was estimated at 1.6 million people. In other words, migrants represent today in Chile 8.3% of the total foreign-born population. Why did we have this unprecedented migration in the country? Well, political, economic, and social instability in Latin America led to a dramatic rise in migration, and Chile emerges as a destination given the stability that the country has in the region. With this, irregular migration started to rise as well in the country. In 2022, the Chilean government changed its migration policy with the hope of developing more adequate laws following the migratory trends present in the country. These changes reflected a shift in emphasis from security to inclusivity. The announcement in 2018 and later implementation of this new migration policy led to a surge in irregular migration, creating an unprecedented situation in Chile, as the process to enter the country were now much more restricted. Necessity and other factors led people to move ahead with the decision to migrate, leaving in some cases their families and livelihoods behind in the search for a better future. By the end of 2022, the Chilean Institute of Statistics estimated irregular migrants in the country at 6.6% of the foreign-born population. This is about 107,000 people. Of those, 12,000 are children. With this comes probably a familiar story. The local population began to express animosity towards migrants and increasingly blamed them for rising crime rates, unemployment, and other social ills. The latter is further ignited by the political discourse to gather support that in turn increases xenophobia. Social peace became disrupted. The Chilean government had limited resources and capacity to control and respond to this migration trend adequately. As a reactive measure, and with the increasing number of irregular migrants, in 2023, the state issued a temporary special decree that would allow the armed forces to perform duties related to border security. The deployment of the armed forces at the border raises concerns about potential safety for the migrants, as the armed forces are not educated or prepared for migration management. It also drives migrants to seek alternatives to avoid control from the military, using riskier routes, relying on smugglers, all under adverse geographical and climate conditions. Numbers don't lie. Between 2021 and 2022, 61 migrants have died at the border under different circumstances. This shows that the current armed forces mandate at the border is not strengthening peace building aligned with current migratory efforts. But what if there's another way? One where we could use the capabilities and capacity of the armed forces differently. This made me look closer to other countries where we had commonalities. And I found in Brazil an excellent case that could be replicated in Chile. Operation Welcome is the response by the Brazilian government to ensure humanitarian assistance to migrants and refugees from Venezuela. Its work is executed and coordinated by the government with the support of agencies of the United Nations system and more than 100 civil society entities. The armed forces provide logistical support to the operation with actions in infrastructure, transportation, health, and administration. The strategic aim to provide greater opportunities for socioeconomic integration and by strategically relocating people across the country to reduce pressure on public services in the states of northern Brazil. The result, as you can see, since the operation began and until October 2023, over 117,000 people have been aided with the project. It have been relocated across the entire country in over 600 cities. So the question is, can the Chilean armed forces adapt to this new humanizing strategy? I believe they perfectly can. Since their creation, they have been a fundamental part of the Chilean society, contributing to national development by, for example, constructing roads in Patagonia, providing primary and secondary education, and serving as a social platform for those with low resources. And even in the face of natural disasters, aiding those in need, and later helping in the reconstruction of their livelihood. Now, you could ask, what are the difficulties of implementing such a project in Chile? Well, every large project comes with challenges. First, the operation is costly in terms of human resources. Second, setting up facilities and bringing technical expertise brings, of course, logistical problems. Third, there will be a need for a large government campaign to promote this new policy and to promote social education also in the society for the benefits of this inclusive alternative. And finally, and I think this is the most important point, there needs to be political will to move forward with a policy of this kind that will go against current popular opinion. However, I do believe that this could be a humanizing turning point in the irregular migrants in Chile. By promoting a welcoming policy on the ground, levels of irregular migrants could be reduced. In practice and in the long run, we could have people adding value to society. Therefore, the perception of society towards migrants could eventually improve. Let's change the paradigm of the use of the military forces in these situations. However, to make it work, it requires us all to be a part of it. These efforts are not only a state responsibility. A major component in the success of the project involves society, common people, and civil organizations. We all have a role to play. That is from self to society. To promote human rights and peace in Chile, the current migration policy at the border needs to focus on strengthening migrants' welfare and their inclusion in the community. And to achieve this, the military could play a critical role in promoting humanitarian engagement. And maybe soon, we will never have to see images like this of men, women, and children detained at the border to prevent their entrance in the country. And instead, we could see more of this. People full of hopes and dreams for a better future. Thank you.
Hey everyone, my name is Carolyn Schul, and I'm very happy to be here to moderate this panel. Maybe we can just start by giving another round of applause for those amazing presentations. They were really, truly excellent. And I want to make a few comments before asking each of the fellows a question and then turning it to the audience. And one thing I want to highlight first is just how enriching it is to learn from your personal experiences and how the insights and the suggestions that you're offering today are coming from a place of real knowledge because of the experiences that you've had before doing your graduate level studies. And so, you know, Christian, that we can see the pictures of you being present in these reintegration discussions and visiting these rural communities and seeing what is the reality, what's happening, really how valuable that is. And Mustafa, I think we were all moved hearing the story, not only of your childhood, but your work with this project between 2018 and 2021, and particularly this story of walking from village to village, 1 mile from the Taliban, not bringing a weapon in order to build trust, is, you know, that's a real commitment to development. And then Jorge, what a pleasure to have someone who's been a captain in the Chilean army who's helping us think about how do we use the military. I mean, I study migration, and I think it's very easy to come across perspectives within academia where we are very quickly critical of the military and the militarization of the border. And I think something that Jorge has brought to his perspective is a real sensitivity to the people who have the boots on the ground, who are in the army. So he's thinking very much about the rights of migrants, but he's also thinking about what's fair to these soldiers who have to police the border, you know, and I've heard many stories of, you know, soldiers not being prepared or trained to be able to play this role of deterring people from crossing the border. And so a sensitivity to that as well has brought a real humanization, I think, of the conversation about what do we do where we see these crises at the border. So the title for this panel is In Search of Sustainable Development and Peace. And I think each of you brought out the interconnection between sustainable development and peace. And actually that sustainable development is a prerequisite for peace. I think, Christian, what you really showed is that in Colombia, as we all well remember, this peace process, I mean, there was so much hope, so much enthusiasm. Finally, a peace agreement has been made. But without that investment in the sustainable development and the promises that came with that peace agreement, that it was doomed to fail. And I think really showing what that looks like in rural places, and the need for local development in those rural places, I think you bring an interesting dimension to that conversation. So you're also, thinking about, we can't just expect the government to be able to do everything either. So then how might there be creative ways to have public-private partnerships to be able to meet the needs of more rural, peripheral places? Mustafa, I really like that you titled your talk Humanitarian Aids to Sustainable Communities, and the emphasis on communities. And I think one thing that really came out when you think about a shift from an aid-based approach towards a sustainable development community-led approach is this theme of capacity building. And it seems like that's something that's been interwoven into everything that you were doing, that this was very much about raising up community leaders, teaching skills that people would be able to carry with them. And again, local development that integrates humanitarian aid with more development-based approaches. And I think this really challenges us to think about how do we move beyond sort of the silos that exist within the development field, and even within how finances flow. And then, of course, I think many of the insights that you raised in your presentations also come out in your presentation, Jorge, in the sense that, of course, it's also the lack of sustainable development. It's also political and economic crises that are the root causes of migration that is then crossing the Chilean border and causing, the perception of border crisis elsewhere. And I think one thing that you highlighted that's really quite kind of provocative is that this need not be a crisis, and that if we want to rethink how to use the army at the border, there's actually a deeper question about how we see migration and whether the influx of migrants is inevitably something that leads to crisis within societies. And I think what Operation Welcome can teach us is that actually with a more coordinated federal response that distributes migrants to places where actually people need migrant workers, that actually that can be more beneficial to the migrants themselves, but also to destination societies, and that immigrants can also contribute to sustainable development at destination. But to do that means really rethinking kind of how we see this migration and how we facilitate it, how we manage it. And that's a real challenge, not just to Chile, but of course, something that we're all thinking about in the US today, I'm sure. And then the last point that just kind of struck me listening to you present is just how much the periphery of countries matter to the peace of countries as a whole. And so hearing about whether it's the border of Chile or rural Colombia or these northern villages in Afghanistan, often when we see and we measure development, we tend to use national level indicators, in terms of progress in education or income or GDP, whatever it might be, but how much those national level indicators might mask, and in particular, masking rural and urban differences. And so I think, what's happening at the periphery of countries, what's happening in rural places is fundamental to the future sustainable development of countries and to the future promise of peace in these places. So thank you so much for your presentations, all the insights that came out of them. They were very thought-provoking for me. And so I'd like to ask you each a different question. And I'll go in the order of the presentation. So Mustafa, my question for you, and I'm sure others in the room were wondering as well, I mean, you described this amazing project from 2018 to 2021, looking at education, agriculture, and livestock, employment questions. You were thinking about women, good governance. And then, of course, the end of your project was 2021, when there was also the Taliban takeover. And so my first question is, what happened, you know, when the Taliban did take over, what happened to the results of these projects? And then my second question to you is, what insights do you have for strategies for sustainable development that might be more enduring, even in the context of a Taliban takeover or a Taliban administration? Are there still strategies for development that will continue to improve lives and well-being, even in the midst of very difficult political and other crises? So thank you.
Thank you so much, Caroline. I think it's difficult questions, particularly in context of Afghanistan. First, I would like to just say a few short words about the how we developed this project. So this program that had three components: agriculture, education, and good governance. So I was involved with implementation of different projects. So these projects we come up with going to the community, listening to them, and developing a community-led solutions. That what are the community needs? Because this is very important. And next thing is the context. Because something doesn't work in the village of Afghanistan that we read or we study in the university. So we have to develop anything that based on the understanding, based on the needs of the people. So after the, particularly this project was from 2018 to 2021. And after 2021, in the beginning of 2022, third-party evaluation carried out to assess the effectiveness of this project. And the evaluation findings that I'm analyzing that as well and incorporating in my master project, it shows that the project is continuous because in education, we build skills that we transferred and delivered those skills to the women, particularly with the vocational training centers that we provided short-term skills like bakery, tailoring, that women can go to their home and they can do their work from their home. And why these youth development centers? So we built it for youth development centers that each could teach more than 400 students from boys and mainly the girls. But unfortunately in this context, so working with the woman in the future is a challenging, but we have alternative solutions. And since it was a capacity building, we transfer the capacities, so it is with them forever. And regarding the strategy, since I was involved with many different projects, and as a monitoring and evaluation manager, since I assist different projects, and I come up, and also I'm working with in my master projects, so combining humanitarian and development is one solution. Because in a community in Afghanistan, they are conflict affected, they have multiple needs. If we go, I saw the project that donors approach them and provide them hygiene kits, but their main demand was food. So in the meantime, we have to consider those multiple needs and combine the humanitarian development. I'm not talking about the emergency like natural disasters that we had different projects like emergency response mechanism, but part of that, we have humanitarian projects that is semi-development, and we incorporate with the development factors. So this, how can it help? It helps that it increase the coordination among the donors, and also it prevent from program overlaps. And this also help the beneficiaries to come up with the adversities. You know, if we deliver the aid, only deliver the aid, so 49 kg of wheat, for example, there were many projects like this. So it was only for a week or 2 weeks. And after that, the beneficiaries, the people who are vulnerable left like that. So developing a concept to address multiple needs and to help them to come with a self-reliance is the strategy that, yeah. Thank you.
Thank you very much. Christian, I think one thing that you emphasized in your suggestion for alternatives is really to strengthen the underlying development in these regions to really set the foundation for a peace process to be successful. And in the back of my mind, also in light of Jorge's presentation and my interest in migration, you know, there's another dynamic that's at play in Colombia right now, after 2016 in particular as well. And that's the crisis in the neighboring country of Venezuela. And of the estimates are that there are maybe 8 million people who have left Venezuela, and Colombia has been one of the largest host countries for Venezuelan migrants. And so I was just curious to hear a little bit more about, has this migration dynamic impacted the peace process in Colombia? If so, how? And if not, why not? And what can we maybe learn from that?
Well, is it working? Yeah. That's a great question, Professor Caroline. And by the way, I'm glad that I'm in the same panel with you moderating. Caroline's a brilliant professor. I'm her fan. Definitely. So I come actually from working, before going to Colombia, I was working in Operation Welcome as presented by Jorge on the Brazilian border. And being in Colombia, well, you saw how complex this context of peace agreement is, right? And to be implemented especially. And as you mentioned, Caroline, Colombia is the country, so 8 million Venezuelans are displaced from Venezuela, are migrants outside of Venezuela right now, but Colombia received 2.5 million Venezuelans. So if you remember, the population of Colombia is 44 million. That represents 5% of the population. So a country that already struggles to implement the peace process, to implement development, to reach its arms, to extend its arms to remote areas and the rural population, to be in the territory, to be present with this institutions for its population. How can this pressure of 2.5 million people more, how can the government deal with this, right? So it's very complex. And I was there while I was working there. I lived right next and worked right next to the Pan American Road, the highway, right? It's a highway that crosses the entire America. And the Venezuelans, we could see them coming down from Venezuela with their backpacks, with their babies, with their little carts, bringing their stuff down on the highway to stop in Colombia, to go to Peru, to go to Ecuador, to go to Chile. So it was a very complicated situation. And indeed, many of the Venezuelans that were coming and leaving Venezuela, they were stopping in Colombia and in the south of Colombia, in the rural areas, and they didn't have anything. They didn't have money, they didn't have jobs. Some of them, unfortunately, ended up working for the guerrillas in illicit activities because they represented cheap labor. They represented someone that would accept anything to have something to eat. And it was very to see Venezuelans and working with the guerrillas, for the guerrillas, not because they wanted to, but because they didn't have a choice. So unfortunately, that's the reality there. And hello, I swear it's not my fault. So it's pretty common to see, meaning there is an impact in this peace process, and it doesn't make it any easier. Actually, it brings more challenges for the government to address this other population, vulnerable population, that it's also in need. So.
And then, as you mentioned, many of these migrants are moving down to Chile. And they're not just moving to Chile, many are coming to the US as well from Venezuela. And the example that you gave of Operation Welcome in Brazil and the insights that you think we can learn from it, of course, I was thinking how nice it would be in the US if we did have a federally coordinated response. And I think what we see playing out is this real tension in the US between the state level responses, the federal level responses, calls to militarize the border even more intensively. And so I just wanted to ask you about, what do you see parallels in what's happening with the border crisis in Chile and what we see in the US? And do you think there are insights that the US can also learn from Operation Welcome?
Yeah, thank you for the question. I think that, well, the only thing we have in common is the actual fact that one person wants to move from a country to the US or to Chile. That's the only thing we can compare. The other thing that we can see is that when a person decides to move, they will move no matter what. So by increasing restrictions by laws or by increasing restrictions by physical security in the border, this will increase the irregular migration because these people want to move no matter what from their country to their new destination. It's a normal process. And you can see in the Chilean case, what happened is that in 2018, we had the announcement of this new migratory law, which addressed inclusivity, but it also has the responsibility to consulates in the other countries to give visas for people to migrate. So in the case, for example, of Haiti and Venezuela, people who were desperate to move to Chile, they said, I can't wait until the consulate gives me an appointment, 6 months, a year. They just took their things to move ahead. So we started with an increase of irregular migration, and then they announced, let's use the military. So what happened next is that we increased the alternatives for that irregular migration. So traveling by foot over 4,500 meters above sea level under harsh conditions during the night, minus 20 degrees during the day, above 40, highlands of the Chilean northern part, and that desert. It's a complicated issue to address. So people were trying to do that. They were then relying on smugglers not to risk their lives, but they actually made it worse. So, and we also are using forces. We're using the armed forces, which can be seen as a security component, but we're actually, and I'm saying this for 18 years in the Army, we are not prepared, we are not educated for migration management. We were prepared and educated for defense, for war. That's the mission. So when you take these people out and you put it in a different context, it's difficult to address these issues in a normal way, as it could be, for example, a border police, or even the police force or customs in their own countries. Differences: a federal government, a centralized government. That's the main difference we have between the two countries. Chile's law, like I mentioned before, talks about inclusion. So we have a contradiction between what we have in the law and what we're currently doing at the border. So my proposal is to address migration management in that inclusive way, using the capacity and capabilities of the armed forces. We're very good at one thing in peacetime, and that's logistics, administrative support. We're excellent at that. Let's use our capabilities doing that. And the other thing that it's interesting is that Chile has a complicated legal system. So even though we have a presidential decree that allows the armed forces to be employed at the border, and we have rules of the use of force under that presidential decree, this was a thing that the Congress passed to the president as a constitutional reform. So for a period of 90 days, the president could issue a special decree to allow these things. So what happens is that we have a decree that has the same legal stature as the normal law, but at the same time, we have a Congress that is discussing these things. So this brings a legal uncertainty for people on the ground. It's like when you do, for example, a tax reform, and you want to bring investors down, and no, we're discussing here, but the president is doing this. So do they want to invest in the country? Do they want to move ahead? It's the same thing with the army. People on the ground are I wouldn't say fear, but they are very uncertain of what could happen if they actually employ the force. And normally, the employment of force in the military is lethal force. So that brings a problem. Regarding what you said about Brazil, I think what we can take as an excellent example, but this is a little bit more above my scope of research, is the actual relocation process they do. I could see that the US could implement something similar and take the stress out of, for example, the state of Mexico, the state of Texas, and relieve the pressure they have currently and address it to other states to equalize like the capacity of the United States immigration management. In Chile, for example, the first third of the country, north, we have 1.2 million people of 20 million inhabitants. In the last third of the country, we have 200,000 people in 1/3 of the country. So our entire population is concentrated in the middle of the country, and we have Santiago, the capital, that has 8 million people living in it. So why don't we use this relocation process to promote this socioeconomic integration of people? We can push economy in those regions and promote further investment and so on with this huge labor force that could have rights and be regularized inside the country. I don't know if I answered your question.
Wonderful, thank you. So I'm going to collect two questions at once, one from the audience and one from online. I see a hand already up here.
Yeah.
I think just behind you, sorry. It was really high up, but you can.
It resonated. Hello. Oh, yes. Thank you so much for your presentations. All three of them really resonated, and it resonated as a Rotary Peace Fellow. It resonated as a son of political refugees. And it also resonated because the way in which you told a personal experience, a complex issue, you showed that peace building was very nuanced and difficult, but you all had calls for action. So my question is, in that call for action, what is the role of the international community? You talked about political will. You talked about sentiment changing. What is the role of the international community? Sometimes the personal is connected to the political. What can international humanitarian organizations do? Which ones can help to move what's happening in your experiences in the homes and the communities to which you've had experience?
So we'll take one question from online, and then each of you can decide whether to answer this or the other question that's been asked.
Okay, this one also deals with the issue of political will, and it's more relevant to those that are from democratically elected governments. How do you make these proposals or changes that you indicate have impact on society's perceptions or support for making them? So if you could talk about how do you, what are the challenges of doing things that you know someone or a group of in society will complain, or there might be some unrest. So how do you mitigate that?
The question about international organizations and the question of political will. I saw you had your hand for international organizations. Would you like to
Yeah,
kick us
sure.
off?
So like I addressed in my presentation, and using Brazil's case, currently they are working at the border, for example, with UNHCR, with IOM. We also have in Chile agencies, the same agencies. Why don't we integrate them into this holistic response to migration? They have the expertise, the technical advisory. Currently, what is happening is that we have this decree that has a general appointed for security enforcement. And all the things that fall under this umbrella of security response are under his responsibility, but everything else is in parallel coordinated, even the international organizations. So there's no connection between all the agencies, state agencies, and international agencies on the ground. Why don't we build a structure that supports all, and each one of them can address and put their input in addressing this situation better? So I will respond to that. Yeah, there's technical expertise that we could use, and we're currently not doing anything. What is happening on the ground is actually For example, soldiers or units, big units, are asking UNHCR or IOM to provide more in-depth instructions about migration management. What is happening now is the soldiers are getting deployed, and I would say they say they are trained. No, they're not trained. They're prepared in a week or two for security, for migration management, and then they're deployed for 15, 30 days, and they're doing rotations. So every person in 1 year at least spends 3 months at the border. So we're increasing the risk so far of something happening. Thank God, so far, we haven't reached that, that level of tension where someone dies because of this interaction between the military force and the migrants. But let's use the capacities, like I said before, this technical expertise, this expertise of years of migration management is supporting this in a more holistic operation.
Thank you. And for those who don't know the acronyms, the UNHCR is the UN Refugee Agency and the IOM is the UN Migration Agency. So these are actually two different agencies, but in many places they're having to work together to address migration and displacement, which can be hard to disentangle. Christian, do you have any thoughts on either of the two questions?
Hello. I guess just addressing the second question then about political democratically elected, how to increase this how this governments are perceived and the public's opinion about these governments and how to increase that, addressing the problems that we brought here today, if I understood correctly the question. I believe that it's an easy answer and way out for these governments when facing problems like the one in Colombia to go for military answers, right? So let's put the army on the ground, let's fight it. And that, for the short period, kind of increases the public's perceptiveness about how the government is dealing with it, but it doesn't bring long-term and effective dividends to address the root cause of the problem. So for example, when you start to focus on local policies to develop locally led or engaging that local population, offering services and economic opportunities and being present on the long term, you will have results. So not the short term, and unfortunately, governments they only focus on the end of their mandates, right? So it's only 4 or 5 years, unfortunately. So that's why they don't consider long-term solutions. So for example, for instance, if it's an easy way to think. When you create jobs for the youth population, they have an opportunity to decide to work for something instead of going to fight for the guerrillas or to go to illicit activities, right? So at least you're giving them a choice and bringing job opportunities, capacity training, capacity building, vocational training to those local populations so they can engage, they can be an entrepreneur, they can have opportunities instead of waiting on the government assistance or just deciding between joining guerrilla or not. So that will pay dividends for the long term, and numbers matter. So creating more jobs, creating local development, probably in the long term, conflict, deaths of coming out of conflicts would also decrease, and the public's opinion about the government would also increase. So that's my opinion, my take.
Regarding call for action, so I have mentioned in my presentations, and as considering the situation in Afghanistan, so you all might aware of the the basic right of girls and women for both educations and work. It's a big challenges. It is a country in the world who the women and girls are denied of educations. So basically our call is like to raise this awareness and to talk everywhere that human rights is matter. No matter it's Afghanistan or it's another countries. So please care about human rights, and human rights is important, and we should matter and consider each a human being equal. And regarding my experience and expertise to address the challenges is in my case, in my country, Afghanistan, based on my experience, based on understanding that I have worked with the communities, is first to identify and find out the needs of the people. If you find out the needs and the problems, then according to that, we can address those problems. What happened in the past 20 years that most of the aid, of course, Afghanistan is aid dependent. It's important source to solve the problem and bring peace in the communities because they are aid dependent. It's to consider and to find out the needs and accordingly address that problems. It happened that the donors approach from the top without considering the basic and priority needs. So it's important to find out the needs and accordingly solve it.
Yeah, thank you. We have a few more minutes, so time for one more question. Okay, how about the one we skipped over right at the beginning? Here's your chance. Yeah.
Pressure's on and has to be a good one. All right. Thank you, Christian, for your service in Colombia. I agree. Colombia is a beautiful country with a beautiful people and beautiful literature, sublime poetry, magical realism. It goes on and on. My question, though, deals with the peace treaty, which we remember was voted down originally by the electorate in Colombia. So we're looking at the second treaty here. And this is a 6-decade civil war that went on. A lot of atrocities, neighbors killing neighbors, all of those things. Several of us had the opportunity yesterday to attend a really excellent program on forgiveness. Forgiveness is becoming more and more a part of Rotary programming. So my question to you is, after 6 decades of the Civil War, and you mentioned a lot of the reasons why the peace treaty was voted down and that they're being addressed with economic and political changes. But one thing I didn't hear you address was forgiveness. So my question is, does forgiveness play a role in this sustainability of peace in Colombia?
Great question. Thank you.
That's a great question. Thank you. So there is a forgiveness, and congratulations for those who participated in the workshop. I only hear good things about it. Forgiveness definitely plays a role, I won't say in the development, but in the conflict itself, right? And how it keeps rolling over the time. So we have, for example, Colombia embedded in the peace agreement is trying to, it's still in the process, right? It's a long-term process, installing the restorative justice. So, for example, we talk about the former combatants and the guerrillas and the paramilitary and all that, but what about the victims, right? So all the communities that were affected, that were displaced, that lost their family members, all these grievances and right, that they don't go away. So there is, instead of just a transitional justice, bringing everybody to justice and all that, there is another process going on, which is the restorative justice and the truth commission, the truth telling. So the truth telling brings the truth of what happened. Why did those people got kidnapped and they vanished? Where are they? Right? And what happened? Who were the real perpetrators of the atrocities that we saw over 60 years? So there is a place for forgiveness through the restorative justice in Colombia. It's not easy, right? Imagine you are from a small village, you have your family, you lost family members, the guerrilla displaced you, many atrocities and massacres and all that. And suddenly, okay, there's a peace agreement and you get, as a victim, you get to face the perpetrators. And there's a forgiveness process that has to go on. So how to implement that? How does that go? It's different from country to country, from context to context. But in Colombia, they're trying to do that, but it's not easy. There's a lot of stigmatization toward the former combatants from the population as a whole, and especially from the victims, and stigmatization toward the victims too. And as victims, I can say victims, there are indigenous communities and not only regular rural peasants, but the whole Colombian people. So there is a process of forgiveness. And if the peace process takes long, forgiveness takes even longer. So it's really hard, but they are trying as a role model to the world. So through this peace process, that was a great question. Yeah.
Thank you for the wonderful questions, and thank you to our wonderful fellows for your insights and expertise.
We are going to break now for lunch, and we will be back here and start promptly at 20 minutes to 2. So at 1:40, please be in your seats and ready to go for the afternoon session. And there's a buffet upstairs and downstairs. The food is exactly the same. There are tables to sit at upstairs and downstairs. So please have a good lunch. Great questions and answers. Like the nails.
and inclusive good governance. Okay. And I done a survey, and now I'm doing my empirical.
You should go enjoy some lunch. We got a really good one
Yeah.
that's lined up. Yeah.
I will do that. I'm gonna talk to you later. I
Yes.
think you're bit. Something is very similar. Is actually in the heart of the peace.
Okay, yeah, I definitely want to hear more about it, one. Yeah.
I'm gonna share it with you, like, I thank you for the nuclear presentation.
Thank you so much, Amon.
So you changed those.
Testing. Okay, this.
Testing. Yep, that's working. Okay.
Testing. Testing.
I'll sit there. Just sit next to me, turn it off, and then.
Could I ask everyone to please take your seats? Please take your seats. We're going to get started, so everyone please take your seats. So welcome back. We're in the home stretch, and the first thing that will happen now is our final alumni video with class 13 fellow Becca Bartlett, who some of you might remember. And then we will have our final two panels. The first theme is towards remedying the causes of war, and we'll focus on Ethiopia from two very different angles. And then the final panel of our day will highlight this year's conference theme, From Self to Society.
So I got it. Now. Good afternoon, everyone. I hope you had a nice lunch. Okay. So previously, my colleague Alexis talked about gender-based violence during peacetime. Now I am going to discuss about conflict-related sexual violence during war. My title is The Role of Transitional Justice in Addressing Conflict-Related Sexual Violence, the case of Northern Ethiopia. I am from Ethiopia and a graduate studies at Global Studies at UNC. First, let's see what conflict-related sexual violence means. The UN defines it as rape, sexual slavery, forced prostitution, forced pregnancy, and other forms of sexual violence which are perpetrated against women, men, girls, or boys that is directly or indirectly linked to a conflict. So, conflict-related sexual violence is widely used by different countries in these modern warfares. So how can countries move away from gross human rights violations, such as conflict-related sexual violence, to reconciliation and peace? One of the mechanisms that is widely used by different countries is called transitional justice. The International Center for Transitional Justice defines transitional justice as the full range of processes and mechanisms associated with a society's attempt to come to terms with a legacy of large-scale past abuses to ensure accountability, serve justice, and achieve reconciliation. Transitional justice consists of both judicial and non-judicial processes and mechanisms, including prosecution initiatives, truth-seeking, reparation programs, institutional reforms. Countries might choose to implement a combination of these. Today, I'm going to discuss about what happened in Ethiopia. Ethiopia is the second most populous country in Africa. And as of 2024, it has 124 million people. Ethiopia is home to 80 ethnic groups, and it has a history of 3,000 years, and it's called the cradle of human beings. Within Ethiopia, there are different ethnic groups. The majority are the Oromos and the Amharas. The rest of the ethnic groups are minority groups. The war involved the federal government of Ethiopia and the Tigray regional states. The population of Tigray is also considered as minority ethnic group. The main causes of the war include political power struggle between the federal government of Ethiopia and the Tigray regional state, and historical resentments between different ethnic groups, including the neighboring country, Eritrea. As you can see, Ethiopia is found in the Horn of Africa. and it was engaged in a bloody war, and it's considered one of the deadliest war of the 21st century. This war involved the federal government of Ethiopia and the Tigray regional state. The war spread to the neighboring countries, to the neighboring regions of Amhara regional state and Afar regional state. And in this war, Eritrea was involved on the side of the federal government of Ethiopia, and the Amhara militia also was involved to attack Tigray. So the war is known as Northern Ethiopia conflict or Tigray war because major battles were fought in Tigray regional state. When it spread to the Amhara and Afar regional states. The war lasted for 2 years. So what are the consequences of the Northern Ethiopian war? The death toll is estimated to be between 600,000 to 1 million. The estimates are contested. Different sources release different numbers. In 2021, 5.1 million people were displaced, and it's the largest in a single year. One of the major causes of the major consequences of the war is the damage of infrastructures, such as health facilities and schools. 85% of health centers and 70% of hospitals in Tigray regional states were destroyed. 2,400 health facilities were destroyed in Amhara and Afar regional states. And in 2022, the US government estimates that 900,000 people endured famine in Tigray. In 2024, around 20 million people need food aid. This is released by World Food Program. When we see the number of women and girls who experienced sexual violence ranges from 10,000 to 100,000. UN reviewing hospital document estimate that over 10,000 women and girls experienced sexual violence. Other statisticians estimate it reaches up to 100,000. So what are the causes of sexual violence? The main causes of sexual violence include gender inequality, lack of protection and support, culture of acceptance or normalizing sexual violence, lack of laws, lack of convictions, using rape as a weapon of war, and groups perpetrating sexual violence to intimidate and humiliate their opponents. What are the consequences of sexual violence? It includes physical pain, pregnancy, HIV/AIDS, and hepatitis B, mental health problems, fistula, reproductive organ injuries and disorders, isolation and stigma. An NGO called Physicians for Human Rights conducted a study, and it reviewed documents of 305 patients in Tigray, and it found out that 27% of the survivors tested positive for pregnancy, 11% of them tested positive for HIV/AIDS. Due to the destruction of the health facilities, survivors faced double victimization. And the worst thing that the study shows that is 76% of the survivors reported that they were raped by more than one perpetrator. And they claimed that 96% of the perpetrators were military or paramilitary groups. And they also claimed that 99% of the perpetrators were unknown to them. So Ethiopia chose to implement transitional justice process in 2018 when Prime Minister Abiy Ahmed took power, and he tried to implement different political reforms. So between 2018 to 2024, there were different developments to implement transitional justice. And the first phase is called rejection phase. So there was lots of rejections. By 2019, Ethiopia already established Ethiopian Reconciliation Commission, and it was taking different initiatives, and the war broke out in 2020, and the UN Office of Human Rights and the Ethiopian Human Rights Commission conducted an investigation and came up with reports of gross human rights violation, including conflict-related sexual violence. Between 2022 and 2023, Ethiopia has been taking initiatives to implement transitional justice processes. So 2023 is considered as the design phase, and different technical working groups were established and the national consultations were conducted. And by 2024, Ethiopia has already a zero draft transitional justice policy. So the war started in 2020 and it ended in 2022 when the Pretoria Peace Agreement was signed, which was brokered by African Union. This peace agreement was signed between the federal government of Ethiopia and the Tigray People's Liberation Front. So these are the major articles of the peace agreement. It's also called the Cessation of Hostilities Agreement. So I'm going to focus on the two articles. These are the protection of civilians and transitional measures. The article on protection of civilians states that parties who are involved in the war should condemn gender-based violence or sexual violence. And it also states that Ethiopia should implement transitional measures. So as a principle, transitional justice can play a role in addressing conflict-related sexual violence by, there are different mechanisms. Countries can establish truth commissions, document the violations of rights against women. They can also establish domestic and hybrid courts. They need also they should also implement reparation plans, compensation. There is a need to prepare educational materials and create awareness. The other one is the guarantee of non-recurrence. Ethiopia also promised to implement disarmament, demobilization, and reintegration of former combatants, institutional reforms. Many of the defense forces, the Eritrean Defense Force, the Federal Defense Force, and the military forces in the regional state were implicated perpetrating sexual violence. So there is a need to reform. There is a need for security sector reform. So what were some of the responses that were taken to address the needs of survivors in Tigray, Amhara, and Afar regions? Some organizations were involved in responding to these grave human rights violations. This include Tigray Crisis Response. They were giving urgent post-rape care. Dr. Denis Mukwege Foundation conducted an in-depth study and amplified survivors' voices and advocate for justice. Physicians for Human Rights also conducted research, and they were involved in documenting and raising awareness. And in 2021, UNFPA targeted to support 112,000 women, girls, boys by expanding women and girls safe spaces. The Ethiopian government also established one-stop center. 6 of them are found in Tigray, and 8 of them are found in Amhara and Afar regional states. So when we see the initiatives that were taken, they were not enough. As you have seen, there was mass perpetration of sexual violence against women and girls. Most of them were not able to access basic essential responses due to the destruction of hospitals and health centers. Some of them were accessing a year after the war ended. So what is missing from the transitional justice mechanism? Gender justice approach to transitional justice mechanism is missing. What this means is survivors need, we need to address the immediate and strategic needs of the short-term and long-term needs of survivors. And we don't read reports of what's happening. Generally, the implementation of the transitional justice policy is slow. After the peace agreement was signed in 2022, we are now in 2024. But when we read the implementation report, what is done to address the gross human rights violation of women, or is the Ethiopian government implementing survivor-centered approach to address the needs of conflict-related sexual violence? We are not reading all those reports, and the support from the international community is not as much as the need, because we know that many women were suffered because of this war, and they are not getting the support they need. Some of them are not coming out to start with. So their needs are not met, let alone their justice is served or reparation programs are in place. So I have been working as a gender professional for the past 10 years. And as I am a Rotary Peace Fellow, I spent taking different courses at UNC and Duke, and I plan to use my knowledge and skill to support the implementation of transitional justice in Ethiopia by making sure that gender lens is applied to the transitional justice mechanisms. And I urge everyone, social workers, health professionals, lawyers, to support the country to come out of this gross human rights violation, because Ethiopia adopted the Africa Union Transitional Justice Framework, but it needs lots of expertise to implement these mechanisms. Thank you.
Hello? 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 Hello?
Good afternoon, everybody. My name is Gibson Zulu, and I'm a global studies MA student from Zambia. I'd like to thank Rotary District 9210 for endorsing my dream of studying in the United States. And I'd love to thank all of you for making it here. You could have been anywhere in the world, but you're right here with us. Thank you very much. I appreciate that. I come from a low-income family, but I managed to graduate from the University of Zambia in 2010, thanks to a government bursary. In 2013, I got my first job processing refugees for resettlement to the United States, Australia, Canada, and Norway with the UN Refugee Agency. In 2021, my career took me to Ethiopia, where I coordinated the delivery of protection and implementation of durable solutions with the UN Refugee Agency as a head of field unit. My research at UNC is anchored on exploring ways in which positive peace can be sustained by employing a grassroots perspective, a grassroots endeavor, in fragile countries. Today, I'm going to demonstrate the dividends that education can sustain, the dividends that education can yield in sustaining positive peace, especially in Ethiopia. In 2021, I lived and worked in a refugee camp in Ethiopia. My entire career, I had never lived in a refugee camp. So this period was very transformative for me. The Shekole refugee camp was established in 1996 to accommodate Sudanese refugees fleeing the carnage during the Second Sudanese Civil War. Today, the population of the camp stands at 12,200, of whom 1,950 are refugees of school-going age. And these have fled conflict, interstate conflict in Eastern Democratic Republic of the Congo and South Sudan. The Shekole refugee camp provides water and sanitation, education, and primary health care to Ethiopians from 2 host communities surrounding the camp. And that's a way for promoting peace. Some of the findings of my research have revealed that by linking a grassroots peace-building endeavor to long-term development, including education, is a perfect antidote to inequality and exclusion, which are drivers of conflict. However, this is not a situation which obtains because education rarely features in the national development plans of host countries. During a monitoring visit, I came across a 9th grade refugee from Eastern DRC. His name was Gisubio. Gisubio lamented the dismal state of education in the Shekole refugee camp. His story reminded me of my embattled childhood and how his dreams of contributing to restoring peace to the restive eastern part of the DRC and studying at a university in the future hang in the balance. Within the school, there's a computer lab which fosters digital education. The computer lab is one safe space that allows positive interaction between the Ethiopian hosts and their refugee counterparts without triggering conflict. I can never overemphasize the importance of digital education for supporting financial inclusion, not only for refugees, but members of the host community as well. Some of you might be wondering how long an average refugee family spends in exile. The global statistics stand at 5 years and more. For the Shekole refugee camp, most refugees have lived there for more than decades with no end in sight. Repan is a multi-talented refugee from Sudan. Mama Jane, or Jane Masika, is a serial entrepreneur from the Eastern Democratic Republic of the Congo. And these have lived in the Shekole refugee camp for decades with no end in sight. This poses a developmental problem which short-term humanitarian aid cannot accommodate. Mama Jane and Repan are emblems of the dividends that refugee education can yield vis-a-vis promoting self-reliance. Refugee education engenders so many positive aspects for peace. Refugee education, there's solid evidence which substantiate the fact that refugee education mitigates recruitment into violent radicalization or extremist groups. Refugee education mitigates gender disparities. Refugee education mitigates poverty as well. And refugee education is a surest way of attaining self-reliance and promoting peace. During my Rotary Applied field experience in Geneva in Switzerland, with the United Nations Office for the Coordination of Humanitarian Affairs, I had a front row seat to United Nations member states pivot towards a developmental perspective or developmental approach in order to sustain positive peace. And education is a perfect conduit for attaining these endeavors. Ethiopia's ability to provide adequate education for its citizens, let alone that of refugees, hangs in the balance, given Ethiopia's precarious economic status. Ethiopia is one of the low-income countries that hosts about 85% of the world's forcibly displaced people. Besides that, Ethiopia's economy was shattered 2 years ago during the Tigrayan civil war. What this means is Ethiopia is going to need a lot of international support, international partnerships, in order to provide adequate education for its citizens and refugees. In 2018, the United Nations General Assembly adopted the Global Compact for Refugees. This is a non-legally binding framework which is meant to alleviate the pressure of hosting refugees. But besides that, is meant to ensure the prosperity of not only refugees, but members of the host community as well. Cognizant of the intrinsic value of education, Ethiopia made 5 pledges to the Global Compact for Refugees. However, 2 of these pledges include transitioning refugee schools and transforming refugee camps into urban settlements by 2027. However, like I earlier alluded to, attaining these endeavors hangs in the balance given Ethiopia's economic capacity gap. What are the consequences of not supporting education for people like Jisubi and this host? Well, underinvestments in education are going to lead to violent radicalization. They're going to incentivize the entrenchment of gender disparities and poverty as well. Bear in mind that Ethiopia and Djibouti are 2 of the only stable democratic nations in the Horn of Africa. Besides that, Ethiopia is surrounded by a lot of countries at conflict, and a pool of unemployed and disaffected young men creates a windfall for terrorist groups. How can we make a difference for Jisubi and his host? Some of the solutions that I've outlined above are all anchored on international partnerships. This is going to require a multinational response and international partnerships. For example, transitioning the school is going to require partnerships with international financial corporations like the World Bank. Employing of government teachers is going to require support of the World Bank as well. Some of you in this room and some of you who are listening online might elect to volunteer with the Peace Corps or with the United Nations volunteers. And who knows, you could be deployed to bolster the ranks of teachers in that refugee camp. Education is a very powerful tool for social mobility. It bolsters self-reliance, not only for refugees, but for members of the host community as well. Education is a surest path to attaining self-reliance. I leave you this photo of an Eastern DRC refugee who just graduated from the University of Zambia, courtesy of a German government scholarship called DAFI for supporting refugees in host countries. In our own words, education is a surest tool for attaining social mobility and self-reliance. I wouldn't be standing here before you had it not been for education. I hope, it's my sincere hope that through concerted efforts and international partnerships, we can work together and ensure that international peace and the hopes of a better future for Jisubi can be actualized. Thank you very much. Thank you. Thank you very much. Yes.
Thank you, absolutely. Thank you. Hello, everyone. I'm Erica Johnson. I teach in global studies, and we are lucky to have these 2 students in our graduating class this year. I also serve as the director of graduate studies in the curriculum in global studies here at UNC. And we are fortunate to have several fellows as part of our cohort generally each year, and they really I echo the comments of the previous moderators to say how these students and their experiences really do enrich our programs and the UNC community overall. So we are all grateful to Rotary's support for this program. I do not have a lot of comments to say to unite these projects, only because I think they speak for themselves in terms of the ways that they overlap. I want to highlight important features of the title of the panel being Remedying Costs of War. Obviously, we see a lot of factors playing out that are related to conflict, attempts at peace building, transitional justice. We see a lot of the story that is just the simple precarity of life also playing out in places that are struggling with development questions, places that are struggling with governance questions, and how the national flow of people in the case of Gibson's story, but also the flow of people within a country in the case of Sarah's story, really do rely on domestic factors, but also international commitments to figure out ways to stabilize, to remedy these hardships. I will ask each of them one question, and it will be the same question, and then I'll open to the rest of you to offer your insights and have your questions answered. So you each, I guess to highlight the theme of our conference today, from self to society, you each have been professionals working in these fields that you have studied and that you've shown us today. And I know you each intend to go back and contribute on these very topics as you complete your master's program and return to this practical side of work. What have you learned during your times as Rotary Fellows to keep you motivated in this work, to inspire the work, to help you deal with this very challenging set of topics? We'll start with Sarah and then give Gibson a chance to respond.
Okay, thank you, Dr. Johnson. When I heard about conflict-related sexual violence happening in my country, I was shocked. And there were many media outlets that were reporting that rape was used as a weapon of war. And I watched so many videos and I was shocked. I worked as a gender professional, so there were so many projects that I was involved with to address gender-based violence, but I was listening to this widespread use of rape as a weapon of war, and then I decided to write my master's thesis about it, and the courses I took at Duke, Human Rights and Peacebuilding, it introduced me to transitional justice mechanisms. And I also learned that there is a specific topic on transitional justice that was supposed to be given at UNC. So UNC and Duke are contributing to giving the right set of skills and knowledge to students so that they can go back and contribute to bringing about peace and reconciliation for countries that went through wars and that experienced gross human rights violations. So the two institutions are really contributing in coaching and training international students and students from the US.
And how do you stay motivated to do this challenging work?
Yes, it's challenging. When I was watching the videos, when I was transcribing, sometimes I used to feel sick. So it's not easy. I mean, it makes me feel sick when I watch it, but people really lived it. So it's not easy. So, yeah.
Do it for them too, yeah.
Yes.
Thank you. Gibson?
One of the reasons that prompted me to seek further education in the United States was my desire to seek durable solutions to protracted conflict. My work in the camp exposed me to subsequent generations of refugees who were born in exile as refugees. As you might be aware, refugee status is derivative. So you could be born in a refugee camp and be a refugee by virtue of being born in a refugee camp. What I wanted to learn, or the model that I wanted to adopt, was the one from public health. Previously, 10 or 20 or 30 years ago, babies used to be born HIV positive, provided the mother was. But with the advent of technology and with drugs like nevirapine now, HIV positive mothers can deliver birth to children who are HIV negative. So I was trying to adopt a similar manner of starting in the United States, seeking the tools for resolving conflict so that Subsequent generations of refugees cannot be born in exile as refugees. If we do a difference in difference from what I didn't know before I came to the United States and what I know now, the difference is so remarkable. I've learned a lot from conducting a conflict analysis, how to design logical frameworks, how to design monitoring, evaluation, and learning plans, and how to evaluate peace building programs. Besides that, studying at Duke and UNC has taught me how to negotiate for peace, how to mediate, and how to communicate in foreign languages, how to design risk mitigation strategies. The list is endless. I would require an entire day to break it down for you. But these are some of the tools that I've learned here. And if you just look at all of us in this room, we all come from different walks of life and different backgrounds. So what motivates me is multilateralism in order to build peace. There's still a desire out there to build peace. Not all hope is lost, and all wars come to an end. I worked in Liberia for 4 years. Nobody could believe that Liberia has peace now. When in the early 90s, Liberia was infamous for child soldiers, but today there's peace in Liberia. When you drive through Monrovia, there's certain buildings which are pockmarked with bullet readers, but right now there's peace in Liberia. So that gives me hope. That gives me the conviction that all wars come to an end, that provided we work together, provided multilateralism is not a zero-sum game, then we can end 1 or 2 wars. That's what keeps me up at night.
Thank you, Gibson. We'll take questions. Yes, we've got Ty in the center there. It's you looking all around.
Hey, so I had a question. It kind of relates to recent deteriorations in Ethiopian and Eritrean relations, and I'm just curious how that has impacted your projects, if in any capacity.
Yes, please. Layla, there's a second question that's just going to piggyback. Thank you.
Yeah, thank you for enlightening most of us of what's happening in the Horn of Africa. I have been cognizant of that, but I still learned a lot more today from you two. So in terms of the justice that you were speaking to remedy within Ethiopia, that could work. But with the involvement of Eritreans, how would that be addressed? Or how do you think that could be handled with the, the framework of the justice, what the justice said? Transitional justice. I don't see that one is a little bit more internationalized because it was complicated by external forces as well. And that affects not only the Horn of Africa, that affects the whole world for that matter. So the peace is in there is peace for everybody. So thank you.
Okay, it's a very difficult question, and I'm not a lawyer. I cannot give you a definite answer, but from my research, both Ethiopia and Eritrea are not signatory of the Rome Statute. So you cannot take both of them to international tribunal court. So it's a complicated matter, but there needs to be discussion. And the Eritrean Defense Forces were implicated in perpetrating sexual violence against the Tigrayan women and girls. So they need to work on their defense forces. They need to reform their defense forces because they can't continue using rape as a weapon of war. So there should be discussions, and there should be discussions around the fact that Ethiopia and Eritrea should sign the Rome Statute, And this should be an ongoing discussion by lawyers and the international community and the government of Ethiopia and Eritrea. But we need to acknowledge that survivors suffered because of the rape that is perpetrated by the defense forces of Eritrea and the TPLF and the federal government of Ethiopia. So the military was perpetrating sexual violence to intimidate and humiliate their opponents.
Do you have a response to the first question?
I'll be humble enough to admit that she knows more about the conflict of her own country than I do. Yeah, I would say this particular conflict may fall outside my area of expertise for today, but she understands the nuances of these conflicts better than I do because she has lived experiences in Ethiopia longer than I have. I would be remiss to claim that I knew otherwise. But here's what I know.
No, no, it's enough.
Here's what I know, and I'm just trying to explain this. I'm not trying to defend it. I think the Ethiopian Prime Minister is a Nobel laureate. He's a very progressive human being, and he's all about peace. And with people like that in your corner, I'm sure there's the chances of peace prevailing are so great. I wouldn't count him out. So I think there's hope for peace.
There was a first question that.
What was that?
Kind of basically the discussion of the ongoing conflict and deterioration.
Yes, so far from the information I have, the Eritrean forces are still in Ethiopia, and the implementation of the peace agreement is very slow. So we're going to see in a matter of the coming years. But the fact that the Eritrean force should leave the Ethiopian territories, that didn't happen until now.
To just complement what my colleague has just said, first of all, I'd like to give kudos to State Department because the average length of a conflict is 15 years, if you follow history from the end of the Cold War. But the Ethiopian conflict only lasted for 2 years because of so much international pressure and shadow diplomacy that was initiated by the US government, which was led by Secretary Blinken. So I think it's good to give credit where it's due. So kudos to them and their team. Diplomacy, carrots and sticks work in concert. So if there are certain targets which are not being met because of intransigence, then the international community will have to raise the cost of intransigence. If carrots don't work, then you'd have to use the sticks. Diplomacy without sticks doesn't work. So I believe a concerted effort of employing carrots and sticks when members to a peace treaty are not living up to the end of the expectations or the bargain, or if they're reneging on their promises, is the best way to go. That's what I believe.
John, is there an online? Okay, we have a black suit jacket, white shirt.
Hello, my question is for Sarah, and I have more like to learn if you know how is the way like the transitional justice in Ethiopia is addressing re-victimization of women, because we in Colombia we are having something very similar, and that something that is happening is that most of these women that were victims, they have to talk again and talk again about their process and their trauma. So how you're dealing with this thing of, is there something or some policies that there have been implemented during like your experience?
Okay. So I was here since 2022, so I didn't go back home. So I don't have a first-hand information, but from the research I did, Ethiopia is learning about transitional justice, and it's reviewing or taking experience from other countries like Sierra Leone and Gambia. So it's trying to establish technical working groups, but there is double victimization of survivors because the health facilities were destroyed, and after they were raped, they were not getting essential services. Some of them were accessing health services after a year, and maybe most of them didn't even access any medical assistance, let alone legal assistance or psychosocial support. And as you have heard me, there are only 6 one-stop centers in Tigray. And we're talking about thousands, 10,000s of women were raped and by multiple perpetrators. And imagine, are 6 stop centers enough? No, it's not. So their like survivor-centered approach services needs to be present. Like the government of Ethiopia needs support, and there should also be a political will to recognize, to acknowledge that thousands of women suffered and their needs need to be addressed. Like Ethiopia is receiving aid from outside for disarmament and demobilization and for implementing the transitional justice policy, but how many of it is going to address the needs of the survivors? And there are no reports coming out. So donors need to make the government accountable, whether it's channeling these funds to address the needs of the survivors.
Other question? Is there an online question? Yeah.
Yes, this is for Gibson, and it's about the refugee camp, for example, that you worked at, and the future of the people that live there. And what would you recommend for steps to when the camp could be closed and the people could be integrated into society rather just being viewed as refugees?
Refugee camps should not exist in the first place. Nobody wants to be quartered in a refugee camp. I would make recommendations to the Ethiopian government to integrate the refugees in the refugee camp in the villages. There are 2 surrounding host communities next to the camp. So I'll simply recommend that the refugees be integrated in the host communities. That's one recommendation I could make. But then the other recommendation I could make, which the Ethiopian government is already thinking of, or which is already in the pipeline, is they intend to transform these refugee camps into urban settlements by 2027. If you look at the distance between the refugee camp to the nearby host community, it's just a stone's throw away. And the nature with human beings is populations grow. So when you're planning into the future, you need to think 4 or 5 steps down the field. So transforming that refugee camp into a settlement would be a game changer. These are some of the recommendations I would make. And then about 5 years ago, the Ethiopian parliament adopted a law which was going to accord or apportion more rights to refugees, including the rights to work and the rights to freedom of movement. Progress towards attaining those goals has been a little bit slower. So I would recommend that they put up a steering committee to try to conduct a colonoscopy and find out where the bottlenecks are and try to fast track or expedite that process. These are some of the steps I would recommend that we take.
One question signaled here. A quick question, we're told.
I guess this is more looking for your call to action, sort of a generic question. I think 2 of the most powerful words in the English language are I wish. Based on what you've learned and your studies, how would you complete that sentence? I wish.
If we had had one chance for me to fill in a question, I would have said that too. You've called for international people to step in. What do you wish? Who do you want?
Ladies first.
I wish for myself or just
For
generally.
solving, yeah, you can interpret, but for solving your problem, for addressing these issues.
Okay, I wish sexual violence didn't happen in the first place because response. Yeah. Yeah, response to it is very costly, expensive, it damages social fabric. It's a public health crisis. So I wish it didn't happen in the first place.
I wish we wouldn't let or allow geopolitics to polarize us. I wish we wouldn't prioritize corporate politics and geopolitics above human rights and international humanitarian law. And I wish everybody could realize that multilateralism is not a zero-sum game, that striking a deal for peace is not being shortchanged. These are things that I wish for.
So thank you to these fellows for their hard work, for their determination to keep doing it. And I think we get to have a coffee break, or no, a second panel. No break, no break. Stay in your seats. Thank you all.
Great job.
So, can you hear me? Hello? So I wish everybody now stay awake. I really wish. Thank you so much. Good afternoon, good morning, or good night if you decide to sleep. I am Sean, a Peace Fellow from Thailand. My topic today is from the beauty of pristine forest to the beauty of justice. And I would like to begin my presentation by asking you a very simple question. What is your favorite national park in the US? I got Yosemite here. I think this name will be one of the first names that comes to mind, and me too. I've been to Yosemite and I was so stunned by the beauty of the Half Dome, El Capitan, Yosemite Falls. It's amazing. Since I moved here in the US and North Carolina, I really enjoy discovering new beautiful landscape. And one way that I use to express my appreciation to this beautiful nature is by paintings. These are some of my artworks during my time here. Thank you. Thank you. But this leads to the next question to you. How much do we really appreciate those who took care of the nature before us? Maybe not so much. So I would like to take this opportunity again to acknowledge and pay my respect to the Okanishi elders, ancestors, and communities who the traditional carrier for this land be gathering here today. And like the USA, Thailand, my home country, also has incredible natural landscapes. Do you agree, those who've been to Thailand? Yes, but those lands also intersect with the traditional land of the indigenous people and local communities. So my presentation today will take you on a journey, much like the one I have traveled, because the changes in my perception of what makes forests beautiful, I've set myself on a path to help the people in my country change the perception, and perhaps some of you too today. So the whole story started when Thailand adopted what has been called America's best idea, which is the national park system. And established its first national park in Thailand in 1962, following the oldest national park in the US, which is Yellowstone National Park. Here, this is the first national park in Thailand called Khao Yai, means big mountains. It's beautiful, one of the most popular. But behind the success establishment of this beautiful park, it also carried with it the structure of violence, exclusion, and marginalization of the indigenous people and local communities. As you can see here, the establishment of the park followed the forest conservation model or people-free forests, involving using violence and force. So basically, people from the cities, tourists are welcome, while those who have supported the land health are kicked out of their homes. A little different from the US, in Thailand, the idea for establishing national park has some link to modernization of the country during the Cold War period. As you can see from the excerpt here, from Mr. Bunsong, he's one of the key person in pushing for establishing national park in Thailand, saying that establishment of the wildlife conservation law and national park in Thailand has shown to the world that Thai people have moved beyond the barbarism of the people who are only aware of food for stomach, now to the era of civilization. It's time to know of food for eyes, for ears, and for brain. This extremely problematic view contribute to the discourse that the use of resources by the people, by the local community, equal uncivilized, and went about justifying, normalizing eviction of the communities. And to some extent, I think I was part of that product too, the product of the discourse. This is a book from my childhood. It's one of the thickest and most expensive book. It's all about national park in Thailand. I remember reading it over and over, and I felt like I traveled to all places. I grew up with the love, with the book and with the love for nature. But most importantly, that means I grew up knowing about national park, but not knowing about the people who took care of the park before and actually lived there before the establishment of the national park. And when we grew up with the global issues the world are facing, we learn more and more the importance of forest resources, from being carbon sinks, water resources, generating income from tourism, or biodiversity conservation, education, and research, to mental health benefit from being in nature. But what is missing from here? What is missing from what we learn? I think we're missing that it's also the home, food, culture, identity for so many groups. It took me about 20 years to learn that conservation, it's about much more than ecological values, but it's about the hierarchy of values and who gets to decide on those values. I deepen my relationships with the indigenous people when I get to work on the project that allow me to spend time with the communities. Through this process, my perspective about conservation underwent profound transformation. I learned that the centralized and authoritarian governance of forests contributed to the plight of indigenous people in Thailand. So now I would like to take you to the northern and eastern forests of Thailand. So let's follow the elephants into the communities. So it's home to Karen or Pakayor indigenous tribe. So they are one of the main groups that live in the areas. Beautifully, they are also known as the tribe that live closely connected to the nature. When I was in the community, one of the members proudly present me one of the traditional practice that keeps the forest thriving. It's called the Potu. It's when the child is born, the father will place the umbilical cord into the bamboo tube and tie it on the tree. It's believed that the child spirit remains on the tree forever and prevent anybody to cut it down. So this shows the deep expression of their identity. But despite this, a lot of community has been persecuted by the government. They've been forced to change the traditional livelihood practice. They have limited access to forest products. They've been forced relocated from their home. Their houses and granaries burned down. Also, many activists were forced to disappear. All the incidents that I just have shown you now highlights that current people are one of the most disenfranchised, marginalized, and discriminated against group in Thailand. But moreover, many have no citizenship, no land rights, not recognized as indigenous people. Therefore, they have little access to the service. So imagine, how would you feel if you've been keeping the forest for centuries, and one day you found yourself being charged as an encroacher in your own home? How would you feel that? Because they've been living before the national park establishment. So this reflects the current dynamic of the forest governance in Thailand, which is really centralized, using eviction and lawsuit against indigenous people, and go about national security reason. But this structure could not have been so strong without being reinforced by the narrative through education system and mass media that made the broader public has a negative attitude toward indigenous people and always put the blame on them. And this attitude support back the policy as a circle. How can we shift this? Over the years, there have been initiatives, policy try to address the issue from co-management of the park, amendments of the law, but the meaningful progress has been slow and limited because of the lack of political will. That's why today I really advocate for the narrative shift and change in the perspective of the broader public, so that we have the public will to influence the political will. I know narrative shift is challenging, but it's possible. As I share through my journey from my experience unlearning and relearning history, having exposed myself to different sets of idea and information, deconstructing what I grew up learning, and recognize my own ignorance, and better understand my core values, and discerning how I can contribute. We can learn a lot from asking questions, who is not included in the conservation effort, and then committing to listen to those voices. That's how we can influence change from self to society. And I tend to see myself as a bridge. My role is a bridge to bridge between what I have been understanding, what I have been learning from the local community with the broader Thai people, to make them understand better the indigenous people, both the ecological knowledge with wisdom and the injustice they've been facing. But either you live in Thailand or live in the US, we cannot build a bridge between the harmful past narrative and the more inclusive conservation effort in the future. You can all be the bridge. And I'm not saying that we should stop visiting national park or feel ashamed about it. But what I'm saying is that protecting nature can go hand in hand with protecting the rights of the indigenous people and local communities. Without protecting their rights, conservation efforts aren't sustainable. It's not truly sustainable. It's going to create more conflicts. It doesn't build peace. Let's imagine if we all together can advocate for what it takes to achieve the injustice around conservation and protecting the rights of the people. One day, we go back to those places again and gaze at the Half Dome, El Capitan, and Yosemite Falls, and know that we are not just seeing the beauty of landscape and pristine forests, but also seeing the practice of justice, the beauty of justice. Thank you.
Wow. Great job.
Thank you.
Wow, what a reception. Today, we've heard about peace building work happening all over the world. We started in Vietnam, went to Ethiopia, Chile, stopped off in South Africa, Thailand just now. This presentation is very different. For starters, I'm sorry to say, but we're not going anywhere. In fact, I want you to stay right where you are. And for the next 12 minutes or so, you might like to imagine with me that you're sitting on this couch. It's where a client of mine that came to see me for therapy was sitting just before you. When that client initially called my office to book in for therapy, over the phone, they told me they were feeling burnt out and exhausted. Say more, I said. I've stopped being effective. I'm overwhelmed, and I think I might even be having an identity crisis. I see. What is it that you'd like to get out of therapy? I asked. I'm just so overwhelmed by all of society's problems. I don't know where to start. Well, let's just start with your name, I said. But there was a pause and some hesitation. Well, I'm like kind of a big deal, they said, and I can't let anyone know I'm struggling. My name's Peace. Peacebuilding? Okay, Peacebuilding. How's this Saturday after lunch at about 2:30 p.m? G'day everyone, my name is Alex, and my job is to take organisations, institutions, and sometimes even entire disciplines to therapy. Over the past 2 years, I've been studying for my Master of Social Work at UNC, and metaphorically at least, I've been seeing peace building for therapy pretty regularly. Today, I want to welcome you to the couch as I share with you the lessons from my therapeutic work with my metaphorical kind of big deal client, peace building, and explain why focusing on ourselves creates the conditions for peace to thrive everywhere, something that I call the lantern approach to peace building. At its heart, the lantern approach to peace building takes the idea that systems are made up of parts. Parts are made up of people. And people are made up of light. Light represents the quality within each and every human being that is sacred. Human rights scholars define this as inalienable, Religions call it divinity. You and I might call it humanness. And the symbol of light helps us visualize it. Throughout our lives, things can happen that affect the brightness and strength of our light. Certain conditions, mindsets, or experiences can even change the way our light reaches others. The thing about our light is that we actually have a lot of influence over it. So it stands to reason that if I can focus on the quality of my own light, I can have influence over the parts of systems I live and work in. If others around me also focus on their lights too, together we can enhance the quality of light of the whole system. The whole is just a mirror of the parts, after all. Peacebuilding came to see me for therapy because they were experiencing flashlight syndrome. It's what happens when it's been really hard to focus on our own light because of the urgency of troubles around us. Flashlight syndrome, an entirely made up diagnosis, by the way, is when we focus all of our energy, training, and resources on trying to fix external problems, and we get distracted from the important work of deepening our relationship to ourselves. The symptoms of flashlight syndrome include being a workaholic, overwhelm, exhaustion, and vicarious trauma. One of the telltale signs is practicing that particularly unpeaceful brand of peace building, the superhero complex. Just like an actual flashlight, when we feel this way, our light can be isolating, create sharp shadows, and narrow our field of view, making it nearly impossible to see the bigger picture. The thing that keeps us in flashlight mode the most is the belief that we alone carry the burden of change. When my kind of big deal client Peacebuilding came into the room, they took off their cape and flopped onto the couch. Their time on the front lines generated feelings of urgency, overwhelmed them with a sense of duty, and made them feel guilty for focusing on themselves. And you know what? It happens to the best of us. I reckon that if you and I had to recall a moment of urgency, overwhelm, or duty, the feelings of flashlight might be pretty familiar to us too. As a social worker, my role is to bring more and more attention to what generates healing. Systems are limited in their capacity to heal themselves, but humans are not. Even the most egregious traumas can be integrated and healed with the right supports. But we have to start small. And so my work with Peacebuilding over the next few weeks was to help them focus more on themselves. At first, this felt totally counterproductive to them. They asked, "Isn't it selfish to focus on me when so many others have it worse?" But with gentle guidance, patience, and non-judgment, over time, Peacebuilding noticed that their symptoms of flashlight syndrome started to reduce. They noticed that when they engaged in compassionate self-inquiry, their light started to radiate outwards and their field of view expanded, helping them to reconnect with a felt sense of peace. Over time, Peacebuilding answered their own question and saw that when they engaged in compassionate self-inquiry, their ability to radiate positive change dramatically improved. Just like a ripple effect, the tiniest steps towards healing produced huge shifts, and sometimes in unexpected places. As Peacebuilding transformed their approach from flashlight to lantern, they went from wanting the world to change to wanting to be the change they saw in the world. And you know, it's not just social work that believes the lantern approach to be the best one. Research from neurobiology tells us that our own internal states can have a profound effect on the emotional states of others, because as humans, We're hardwired for connection. And it's not just in some abstract or metaphorical way. Our ability to regulate and embody calm compassion is not only felt by those around us, but it's also intricately linked to the mirror neuron system, a set of receptors in the brain that enables simulation of another person's internal state. This means that when we focus on ourselves, not only can we impact the strength and reach of our light, but we can also affect how others experience its clarity and warmth. This is such a gift, because when we share our light and our hope with the world, it truly can be felt and experienced by others. But we have to want it for ourselves first. Remember, when individuals within the system move towards lantern, they help the system as a whole be more lantern. And here's the best bit. Even if we can only take tiny steps, anything that produces more healing at any level is a net gain for humanity. As an organisational change consultant, I advocate for the lantern approach, prioritising internal dynamics over external challenges, especially in peace and conflict work. Recently, a non-profit organisation, let's call them Food Aid for Peace, sought my advice on how to improve the outcomes of their aid for recipient communities. Initially surprised, Food Aid for Peace accepted my advice to turn their attention inward, shifting the front lines of peace building back into their own staff and teams. To do this, they practiced self-inquiry, spent time getting into right relationship with each other, and focused on their own well-being. And as a result, challenging conversations were more possible, which improved accountability. There was less staff turnover, which created more trust. And the more that staff acknowledged their own limits and vulnerabilities, the more room they made to connect with each other and the recipient community. The NGO noticed changes, but more importantly, so did the people they serve, who felt more listened to and experienced the organisation as more attuned, authentic, and compassionate. These impacts can remind us all that work on the self is inseparable from work on society. One enables the other. And while this shift inward may not be intuitive for all of us, it forms a crucial starting point for peace building work, one I've been really privileged to explore with the support of the Rotary Peace Fellowship. Maybe you're thinking, it's too late for me, or I'm just not that kind of person. Well, if there's only one thing you take away from this talk, let it be this. We all have the capacity for lantern. It's just a matter of imagining beyond what we can see right now. The reality is, peace building can't go to therapy, but we can. And when we do, we embark on the process of gradually becoming more lantern in our approach. Oh, and by the way, in case you haven't figured it out by now, lantern is just another word for healing. Of course, you might substitute therapy for any number of things that feel relevant to you and your culture, like mindfulness or spending time outdoors. But the point is to consistently direct our attention inward, engaging in the kind of self-reflection that creates internal space for knowing our darkness well, because only then can we be truly present with the darkness of others. So where to from here? Well, they say that peace building is the only job you can never fully leave. So like it or not, we all have plenty of opportunity to practice the lantern approach, starting right now. We can envision our relationship to peace by starting with the self and scaling up over time. But you don't have to take it from me all my kind of big deal client peace building. The shift from the solitary beam of the flashlight to the expansive glow of the lantern is so much better felt than explained. So now it's your turn. Welcome. Where would you like to start? Thank you. Good job. Ooh, you know what I just realized? You're in the microphone. Wait. You good?
Thank you, Emily.
So I'm not sure this is on. Yes, it is. Thanks, Patrick. I am so glad to be the moderator for this panel. I always begin these things without remembering that I should introduce myself. So I'll just say that I'm Adme. I'm a human rights lawyer from South Africa and now from North Carolina. And it really is my great delight to serve as the Duke faculty co-director with my friend Suzanne Maman of the Duke-UNC Center, and to be the moderator of this beautiful closing panel. So our panel, which is called From Self to Society, over the next little while, we will be thinking together about the conference's themes as a whole, from self to society, envisioning our relationship to peace. What beautiful visions, ideas turned into illuminating metaphors, both Sean and Alex have offered us. Poets have a way of helping us understand and feel deeply with just a few words and key images. Poet, policy analyst, and painter, Sean, offered us the image of a sturdy two-way track-foot bridge, helping everyone on that trail, whichever direction they might be coming from, to get across the divide. Those gorgeous paintings, the one that particularly touched my heart is of the morning light filtering through the big trees, reaching the saplings of the undergrowth with what Alex calls warmth and clarity. Poet, social worker, Alex, and almost so many more things, offered us two images to think about the ways we might be bearing our light. So she asked us, when are we acting as flashlights? Being from South Africa, I still call them torches. And when as lanterns, right? So, my goodness, come on, paper. When do we really need to flop down on the therapy couch, quite literally, for the metaphor girl, quite literally, to gather ourselves? So our panel is about two ideas that relate deeply to each other, healing and relationship. Alex called on us to think seriously about healing. In order for us actually to do peace work out in the world, we must first gather our own peace, holding it in our own hearts, minds, and bodies here in our inner world. Bring the front lines of peace building back to ourselves first. So her words about the neurology of healing will sound very familiar to the parents who have had good parenting training. This is me. When our children throw tantrums, much as that might actually throw us into a tantrum, we too must know how to skillfully manage our response. We must be regulated to help them regulate. This foundational truth shapes our professional worlds too. Our strength to support others comes from our strength. How many of us have heard the phrase, physician, heal thyself? Sean evokes the power and beauty of relationship. Much as he loved the pristine forest in his well-worn giant book on national parks, he came to understand these forests were the dwelling place of Indigenous peoples and that he would love the forests so much better if that relationship between Indigenous people and their homes was not summarily cut What if the relationship was carefully understood and honored? Because Chon honors the many communities of Indigenous people with whom he has kept company, he has come into relationship with these people and they with him, the small two-way footbridge. These two driving ideas, healing and relationship, are connected to self and society because we will not be in right relationship with others, society, if we are not in right relationship with ourselves, self. We can be part of repairing the world, Tikkun Olam in Yiddish, because we are familiar with repairing ourselves. Embedded in the poetics Alex and Chon have offered us is also a very social science concept. I'm often criticized for being too humanities as a lawyer, so I'm adding some social science here. The theory of change. A theory of change is our theory of how change comes about. By what mechanisms is the status quo moved? We saw that Alex's slide of the interconnected gears. Her theory of change is illustrated by the move from a single Gerber daisy to a handful of Gerber daisies to a bouquet of flowers. If we change ourselves, we set in motion larger changes in the world. Alex's words bear repeating. Instead of wanting the world to change, we can be the change we want to see in the world. Chon's theory of change turns on the idea of shifting the narrative. Thai policy around conservation and governance will change when Thai citizens reject the narrative they've been socialized to accept. If Chon can come to see the core mistake and injustice of fortress conservation that values the beauty of pristine forests over the beauty of the practice of justice in these forests, then other Thai citizens can too. He can be one footbridge to other Thai citizens, explaining how conservation coexists with honoring Indigenous peoples, one person at a time. The narrative around the appropriate policy framework for national parks and natural conservation will shift. I don't know about you, but I do a lot of podcasts. And in the TED Radio Hour podcast, How to Citizen, that came out in October of 2022, the marvelous writer and comedian, a man named Baratunde Rafik Thurston, put it this way: we can change the action, which changes the story, which changes the system. Systems are just collective stories we all buy into. When we change them, we write a better reality for us all to be a part of. In other words, each of us change the acceptable storyline by what storyline we ourselves accept and what storylines we refashion. So as with the other panels, I will start with three questions to Alex and Chon, and then we'll ask for audience questions. So, no. So I'm going to start with you, Chon. And you both know what I'm going to end with as a question, but this is the opening one for Chon. So, Chon, as you know, in development practice, practitioners encourage the each one teach one method as part of our theory of social change. So, for example, when a family learns how to hang insecticide-treated bed nets effectively, they then teach other families. Can you say more about the way you offer what you have learned to other Thai people who haven't yet had the experiences you've had with Indigenous peoples, the each one teach one methodology? How actually do you go about helping to change the narrative?
Well, I have to say that this is not just one-time action, because you're not just telling people to, okay, you clean your hand and you will save from the bacteria.
Yeah.
But what I'm going to talk with, what I usually talk with people is kind of change the way they think about things their whole life. They're growing up learning about this for their whole life at school, at the school, from mass media. So I would say I have to understand each different group. If I talk to my friends who have a basic understanding about social injustice, that I can go deeper into detail, presenting with information. But then if I talk to my parents who know nothing about this issue and still seeing like opposite to what I see, it's going to be another level. But I'm not debating with them in terms of am right, they're wrong. But I offer, this is another perspective. See, this is a history that we never learned at school. See, this is another practice from other countries. So I think what I've done through my professional capacity, also at personal level, like sharing on my social media platform or whatever, it just by understanding who are you talking to and not going in a way that preaching people, but offering the other way to see things. I'm not sure, is it concrete or?
That's beautiful. Right.
Thank you.
Very lovely. It's really lovely. Okay. So I was so impressed with Erica's question, and I've been so lucky to sit next to the person I sat next to today, honestly. and all day long, my friend has been saying, wow. And this time with Erica's question, she was like, that's the right question. And I was like, you know what? You are so right. So I'm going to ask the same question. I actually had different ones, but so for you, Alex and Joan, I'm going to ask both of you, in our conference today about self and society, so much of what you've written about is self. And it would be really nice for our audience here to understand you, right? To understand what builds yourself. So I wonder if you could speak, both of you, to the sources of energy and motivation that help you be such beautiful selves.
Thank you for the question, Erica/Adme. I feel so much hope. And that's a feeling of hope that has really grown and deepened over the past 2 years of study. I see the relationships that I have in my life as a great source of hope, the friendships that I have, the incredible people that I work alongside, my family relationships, my team relationships, my professors and mentors and people that support me along the way. The quality of these relationships and the depth and the sharing and the mutual support and the kindness is something that really fills me with so much hope. When I see the ways that we can navigate our conflicts, when I see the ways that we can support each other, when I see the ways that we can reimagine what it's like to show up for each other, that's to me is what we do on the small scale sets the pattern for the whole system. So there are so many examples of relationships in my life that I derive a great sense of depth and excitement and hope from. And relationality is an infinite quality, right? You can never have too much of it. It's always there. You can always have more. So I think there's just limitless sources for hope and inspiration.
All right, Joan. At the end of the day, we can clap, right? Can you talk about your beautiful self and where it comes from?
Maybe not beautiful. But I would say what keeps me motivated is the frustration. The frustration about how Thai society, we share it so much about people who has everything already. I mean, I think it's a mentality of a lot of Thai person who always feel so proud about serving people who have so much already, but look down on those who has been marginalized. That's my mentality. I think this is not right. People and minorities, people with disability in Thailand, they've been mocked about, nobody cared about it. And that's not fair. That was something drive me. And we need to change this narrative that, you guys, why are you proud about serving those rich people? Why don't you proud about helping those who are lack opportunity, lack access to basic services? So that drive me to work on this. As you said, as we learned from your class, you are not free if nobody is free, right?
Fannie Lou Hamer, I
How you
love
said
it.
it? You never, what is it?
No one is free until we're
No
all
one
free.
is free until everyone is free.
Yeah, that's it. Doesn't have to be exactly right. You got the right idea.
Thank you.
I'm with everybody else here who says that these students are such a source of richness and beauty in our lives. And honestly, it means so much to me to have these two. I got lucky for this panel, I know. So thank you very much for all that you have done for the people and all the classes that you've been in. You've enriched so many people and in our auditorium here today too. So rather than taking up all the time, I'd really like to, before I see from Susan, we should have a lot of minutes to get some questions. So I'll first look for people here with us, and then I'll ask John for the online questions. Do we have any to start with? I see you, and then I see you. So in the middle.
Okay. Hi, I'm Rezaie, and first of all, this is my first peace conference, and woo, wow, wow, I will be.
Wow.
My question is this: we talk a lot about reflection, peace building, looking inside ourselves to see how we can find solutions using the mirror. How can we translate that into our clubs and our districts? How can we teach our members to do that? Because as a current DG, and I know anyone else in here who's been in my position in this room, the biggest issues we have to deal with are interpersonal relationships. Really, that is the crux of our job. And in order to be more effective for our communities, we need peace within our clubs. Yeah. How do we use this model, this lamplight model, this footbridge model? How do we incorporate that into a program for our clubs? If you guys could like make that your think tank thing, that would be so awesome. Thank you.
Are you inviting them to come to your club? Do you guys want to start? So do you want to start first?
Maybe it's more related to.
Well, I think this launches our official consultancy business. Well, maybe I would say that many of us, probably nearly everyone in this room in different ways, has been taught that conflict is terrifying. For many people in this room, conflict is about life or death. And for those of us who have been privileged to grow up in societies where war hasn't been happening in front of us, conflict is often something that is frightening, something to be avoided, something to turn away from at all costs. But in fact, in the words of Martin Luther King, it's not the absence of conflict that generates peace. And in fact, conflict can be productive and can be generative and can deepen relationships when managed skillfully and in a regulated and attuned way. Of course, that's a huge ask for all of us who have been taught to turn away from conflict very quickly. So I think there is a couple of pieces to that. One is familiarizing ourselves with this notion that conflict isn't always bad, and particularly when held and supported in safe and calm spaces. Conflict can be challenging, but it also presents an opportunity for a repair. And in that repair exists a lot of hope, a lot of connection. We often say it's not the absence of conflict that predicts healthy relationships, it's actually the ability to repair after conflict that says a lot more about those relationships. As a social worker, I would say a really good place to start is running through a set of reflective questions. What feelings does this conflict bring up in me? Where have I seen this before in my life? Why does this feel familiar, or does it feel familiar? Who is this about? Is this about them, or is this about me? So running through some of these reflective questions helps ground us and situate us in our own ability to interact in a much more calm and regulated way. And when we do that, we provide a space and an opening for the repair, and that's where the magic happens.
Unfortunately, I've also gotten the sign that we have only 5 minutes. So can I get one question from online? And then Gideon, can you run up to this Rotarian so she gets a chance? So first, the online question.
Yeah, you both talk about stories we tell about ourselves and how that's how we define how we live. And so, for example, in Thailand, it's the story that we should take this national forest and the benefits of that, but it ignores the people in it. And then you also spoke about how we have the story about ourselves that we can do it all, or we can stick someone else before we look at ourselves. So I'd wondered if you both have an example of where you see, both in the national forest situation or in a community in conflict, where they both took the steps to do it differently that you would point to as a model?
Nice question. Thank you, online audience.
I can take that. There's so many models that has been started as an alternative to very strict national park that's allow indigenous people and local community to take the leadership role in managing the park. But the problem is that it's hard to scale up, especially in those areas that I work on. There's some geopolitics involved in here. As you know that the western part of Thailand is close to Myanmar border where the civil conflict is going on. So Thai government always use the national security reason, try not to give authority or give more participation for the local community in the forest area. So even though we have a really nice model allowing for co-management of natural resources, but yeah, politics always hamper the progress of doing that. But I would say that through the Paris Agreement, through the biodiversity conservation convention, there's a consensus that engaging local community and indigenous people is the way forward. It's a consensus in the global stage at the local level, but the politics is something that really make it go slowly.
Alex, you've got 1 minute.
Okay. I do a lot of work with galleries and museums, and they often are looking for ways to communicate better to their audiences. And when I come to work with them, they often say, we want to get things right for our audience. Help us do it better for our audience. And my work is always, hold on a minute. Let's come back to your team. If you guys can get things right in here in your team, if you can have challenging conversations with each other, if you can explore this historical material from multiple viewpoints, if you can hold each other through some of the challenges, if you can create shared spaces of reflective practice, the audience will experience that. Focus less on them and more on you and the benefits. 100%. This is the best way to do it. The benefits will be experienced by the audience.
I am so sorry. I tried to cue you up, but you know, Rotary runs on time. It's because we have relationships that we want to stay in good relationship with. So let me just say, I hope everybody today takes in your heart that picture of the radiating lantern and that beautiful footbridge that goes both ways. And I just want to say thank you so much for all the lanterns in this beautiful hallway, as well as the footbridges, and especially thank you to you who've lifted this up for us to think about. Thank you so much, Sean and Alex.
We ask all the class 21 fellows to come up to the stage. You could put them on those tables there. And along with Suzanne and Adme and Randy. They need the pile. They need I'm just going to call the names out. We're presenting the completion of the Rotary Peace Fellowship program, which with a certificate and a Rotary alumni pin. So I'm going to actually just call people's names in the order that you're standing. And then if you could come over and well, I'm going to wait until somebody up there does it. Excellent. Okay. We'll need to find the clicker again. It's taken a little, it's gone somewhere. Okay. Excellent. Sean, congratulations. My.
Thank you.
Mustafa.
Thank you so much. Thank you.
Sarah. Christian. Gibson.
Thank you.
Estefania. Jorge. Alexis. Alex. Everybody? Yeah. There's going to be two of them. Yeah. What if? Yes. When everybody's through with their, then Walker will take.
Hey, g'day, y'all, which is about as assimilated as an Aussie can get to North Carolina. I'm back to close us out. Thank you to everyone who is here today. A big thank you to those who came from different parts of the state and the US to be with us. Thank you to those who joined remotely. And if it's between 2 a.m. and 6 a.m. in your time zone, you get an extra special thanks. So thank you, Dad. It's a wonderful opportunity to give the closing remarks. And as I was thinking about what to say, I was reflecting on what a unique experience the Rotary Peace Fellowship is. I was thinking, how am I going to convey to the audience the quality and uniqueness of the experience we've all had over the past 2 years as fellows? So I did what any normal person with no time on their hands would do. A qualitative discourse analysis of the past 12 months of our centre's WhatsApp chat group history. I think the insights really speak for themselves. So there are some methodological gaps in my approach, but I've essentially turned the past 12 months worth of chat since the Class 22 Fellows joined us into a transcript to identify the key themes and meanings. So putting methodological rigor aside, let's start with the top emojis. Now, there's been high expectations over the past 2 years and they've been truly relentless. So what I was expecting was this. What I actually saw was this. Now I'll show you the top 10 words from the past 12 months. Probably no great surprises here. All of the usual suspects, but reading between the lines, we could draw the conclusion that Susan and Tom have had to exercise a great deal of patience with us all. But it really does paint quite a wholesome picture. Over the years, we've used the WhatsApp group to share support and care for each other. This is especially important after big game days where UNC Fellows have gone out to rush Franklin at all hours of the night. We've talked a lot about the North Carolina weather. And this tends to mean different things to different people. We've shared solidarity and hostility. And we've been excellently supported in all aspects of our personal, professional, and domestic lives. A true example of the phrase, "Not all heroes wear capes." To round us out, here is the most loved photo of the year. And so, laughs aside, what's the point of sharing all of this? My point is that all of this says something. No doubt, it says something about the kind of people that come together through this fellowship and the values that guide us in this work. But more than that, it says something about those who make this program possible. Rotarians, through their donations and enduring investment in our education. Our professors and academic mentors, who have resourced us and guided us in our growth. Our partners and families who have had no choice but to ride the waves with us and alongside us. To our incredible Rotary host families. I'm very close to my host family, who have opened up their hearts and their homes to us. Our classmates, who have suffered with us. And our faculty directors, Suzanne, Francis, and dear Adme, who have been lanterns to us at every step of the way. The Rotary Peace Fellowship The Rotary Peace Fellowship has given us something truly incredible. You have each set us up for peace building success in every imaginable way. In giving us this world-class North Carolinian education, you have given us the opportunity to share our light and learning across all parts of the world. And as if that wasn't enough, Rotary gave us Susan and Tom. Incredible peace building professionals who have tirelessly given. I practiced this speech about 20 times to take the sting out of it, but it hasn't been very effective practice time. Okay. Susan and Tom, who've been incredible peace building professionals and who have tirelessly given, supported, shown up, celebrated, and seen each and every one of us for the past 2 years. When you have been cared about, uplifted, and believed in the ways that Susan and Tom and Admay have for us, all of a sudden, anything feels possible. At a time when there is so much pain and conflict and injustice in the world, here in the space between the messages, the emojis, and the photos is so much light, so much love, and so much connection. This is where we find hope, in the co-created goals and relationships that we build with like-minded, justice-oriented people. This is where we envision peace, in the small day-to-day shared interactions that bring about care, support, and kindness. Yes, on the one hand, these are just WhatsApp messages, but on the other hand, they are symbolic of something so much more. And so, my fellows will join me now. On behalf of Sarah, Gibson, Chris, Sean, Jorge, Alexis, Estefania, Mustafa, and myself, thank you all once again for giving us the opportunity to envision our relationship to peace, from self to society.
So we're just gonna take 1 minute. Tom, where are you? Come, Tar Heel, come. We want, just 1 second. We wanted to show our appreciation to Susan and Tom for this wonderful past 2 years. With a small token of our appreciation, just give her, yeah, please, Susan. And Tom. We wanted to give you a Duke shirt, Tom, but no consensus. But we can still fight on WhatsApp who's best. You know who's best. Thank you all for coming. Thank you, Susan and Tom.
And we will see you back in this space next year on Saturday, April the 5th.